Remind you that we are being broadcast online throughout Parliament buildings. So welcome to those people who are in the gallery today and watching online. So if you can ensure your mobile phones are muted, and to remind you that there's no photography or recording allowed of this meeting. So if you're content, members, we'll proceed with the agenda. So we haven't received any apologies as yet. As you can see, we have Carol and Claire are online today. Sinead and... Sorry, go ahead.
Sorry, Chair, Emma is in Brussels.
Oh,
I
right.
thought apologies in, so could you record those, please?
Okay, thank you. So Emma's with the Windsor Framework Democratic Scrutiny Committee's visit, so she's on Assembly business. So maybe Sinead will join us. Okay, if anybody got any declarations of interest to declare? No? Okay, members, so in terms of Chair's business, before the clerk went off, I asked him to provide a number of important documents that I think that we all received in our first day pack. And I think it's really just, as you can imagine, it's off the back of the last meeting we had, and it was really about sort of refreshing ourselves around our roles and functions as a committee, common courtesy, conduct, etc. And I hope you have all had an opportunity to read through that. So going forward, I think that we really do need a reset. I think that the last meeting we sort of lost the fact that we as a team should be working together, as a committee, working together in the scrutiny role, and how we engage with our witnesses, how we engage with the staff, and how we engage with other committee members. So just another thing to advise, so the committee staff has asked the Executive Office, private office, for a copy of the minutes of the meeting that I had with the First Minister, and they have not arrived. Okay, just to confirm, they haven't arrived. Okay.
Chair, there's a couple of comments regarding...
I'll come in after.
Matters arising, that's okay.
So members, draft minutes then, you'll find them on pages 61 and 66 of your pack. Also, the draft minutes that were in the original pack, the clerk identified maybe two omissions under correspondence and any other business. So you'll find in your table papers there's an updated version. So if you're content with the updated minutes of being a true reflection of the meeting, can you indicate? Yep. So you're okay. So I'll go ahead and sign those. Okay. So in terms of matters arising, on page 68 of...
Sorry, Chair, I didn't pick up that. I thought it had just been reproduced, the minutes.
There was two...
Can you clarify what amendments were made to the minutes?
Come in, Chair. The first one was under a... So we look at the draft minutes. They're both towards the very end. The first one was under a correspondence where I'll get there eventually. Mr. Cullen raised a matter in relation to...
We'll come back. We'll come back.
The final was under any other business. Yes. The committee discussed the role of the commissioners in assisting the department with their statutory functions. And Ms Sugden agreed to share with the committee a response to a written question whenever that response came in. That was not recorded in the minutes, so I went through the recording and picked that up, and I came up. The second one was
Don't worry, we'll put you under pressure.
Yeah, looking for it here. Was that the one where the chairperson advised that she'd be meeting with the individual involved and will report back to the committee?
No, I think it was to do with Carol. Was it not Carol?
Yeah, it's something that came up. Look, I'll
find it.
I'll find it. I'll come back to
Let
members. They were both very very minor.
But there were actions.
But they're actioned in the minutes now.
Okay. So just to go in terms of matters arising. So on page 68 of your pack, you'll find the letter that Mr. Gaston read out in the meeting. So we've just put that in for your pack for you to read it in slower time. And on page 10 of the table packs, you'll find the timeline of events. Now, I didn't have any engagement with Michael before he sent these out, so I just want to add one point to it. He said there the timeline, whenever I text the clerk, he said not applicable, so that was it. So he texted me at 7:13 and I responded at 7:22 and told him that I was going in for a swim, that go ahead and meet. So I didn't then pick up anything until closer to 9. So that's why there's no response from me in that time period. Okay, any questions in relation to that? Go ahead.
Yeah, a couple of things just picking up on the chairperson's business and the information you have included in the packs. And I would just like at this opportunity, so under role of the chairperson, there's a bullet point in it to promote openness and transparency in committee meetings. And my firm view is that we didn't have that at the last committee meeting 2 weeks ago.
In what way?
Well, I felt that the way you chaired the meeting, you almost once again shielded the witness. It was up to the witness if they wanted to answer the questions or not. And at times you involved yourself in situations where you didn't need to be, instead of letting the member ask the questions, whether they be hard or whether they
It
were
wasn't
not.
nothing to do with that. It was to do with the remit of the committee, and you know that.
But we had this discussion 2 weeks ago where, based on the legal advice, when it was to do with the confidence of the government, was to do with the confidence on what we've been told, that should allow members to ask questions freely. And I certainly have concerns that in what has been proposed and what is set out in this, that there wasn't openness and transparency. That was then relayed to the public, and later on it talks about impacting the public profile of the Assembly, demonstration on transparent governance, government delivering accountability. We have failed in all them. Increased profile and respect for the work of the committee amongst key stakeholders in the public, and that was all, I believe, trashed 2 weeks ago.
That's your opinion. Thank you for that. You've got no, Timothy. I'm not giving you all day. We've a lot to get through.
I'm not wanting all day. But
No,
I
you
think
do
we need
want
to,
all day.
No, I don't. But you have to. We have to talk about the minute that doesn't exist from this committee.
Timothy, you're not going to delay this meeting much further.
Well, then
I have explained.
Can we set aside time at the end of the meeting to talk about this?
We can talk about under any other business if you want.
And that was the purpose of
but it needs
sending
to
the
have
email
purpose.
earlier on to give notice. This was a subject that I wished to raise. So I would request, if you don't want to talk about these issues now, that at the end of the meeting, you set time aside. Like,
I have no problem. Timothy, I've said I have no problem talking about it under any other business. I'm going to bring in Brian. Go ahead.
Thank you, Chair. Just referring to the minutes of the meeting on the 23rd of October, I do want to put on record my deep dissatisfaction with the performance of the First Minister at that meeting. I had pushed for her to come back and provided a rationale of further questions in the interest of public confidence. And unfortunately, despite her having previously answered questions on some of those matters, we just got evasion. And I thought it was per reflection on her position and on the functioning of this committee. So I just want to state that, because again today we will be discussing issues about historic institutional abuse and the oversight of safeguarding matters, and people expect to see those standards upheld for those who have responsibility. So I think it was a missed opportunity by the First Minister that she refused to answer questions despite knowing why she was being brought here. And the questions will not go away. We need to see that acknowledgement, not just by individuals, but by parties where feelings have been made.
Okay, well, I think that's something you need to raise with her as the
just wanted
Northern
to put that
leader.
on the
Yes,
record.
that's okay. Okay, it's on the record.
Chair, can I just clarify that under any other business, you're allowed me to come back and revisit
Said that
this?
twice now, so I'm going to say it 3 times. Yes, we will come back under any other business.
Okay.
Okay, did you hear it now? Thank you. Okay, members, so we're going to move on. Programme for Government, Commissioner for Older People for Northern Ireland, you're very welcome. You're going to provide us with an oral briefing today. So there's correspondence, members, in your pack. Clerk's Brief 78 and 80 of your pack. So welcome to the meeting, Eddie Lynch, the Commissioner, and Angel. Did I lose it there? Okay, so Policy and Research Officer also with the Commissioner's Office. So if you'd like to go ahead, bearing in mind we have received the cover letter, we've received your submission, so we've hopefully all read it. I certainly have. So if you can keep your opening remarks brief, and then we can ask questions. Thank you.
Thank you, Chair, and thanks to the committee for the invite to come and speak about the programme for government. So I'm joined today by Dr. Angel Lira, who's from the Policy Advice and Research team in my office, who's been working a lot on pulling together our response to the consultation. I'm not going to speak for too long because I think the points, I just want to highlight the sort of key issues for me in relation to this process. I'm very happy to have questions on it, but I suppose that the main points that I've been trying to make now for quite some time is the ageing population is here, and we're living during a period of major demographic change, and that has implications for us all in society. You know, it's rapidly changing to the point where in 2040, you know, 1 in 4 people in Northern Ireland will be aged over 65, and you know, there's a lot of good news around that. The fact we are living longer and healthier for longer, and older people are contributing in more ways as they age. But obviously there's challenges as well in meeting the needs and planning our public services around. So why does this matter today, this discussion, and what does it mean? I mean, the PFG, it matters because it's the single most important, you know, document in government, and for me, one of the big challenges we have as a society is the ageing population and how we respond to that. And for me, you know, when I looked at the document, I was really, to say disappointed is an understatement, but probably flabbergasted with the lack of reference to older people in the document. And when we're trying to make major changes around, you know, reforming our health service and things like that, as one example, we're not going to be successful in getting better outcomes if we're not viewing those changes and designing those services through the lens of an ageing population. It has to be central to the thinking. And my office works across a range of areas like healthcare, housing, transport, social isolation. And, you know, we too often see decisions being taken, policy decisions being taken that have actually negative impacts and knock-on impacts. So, for example, one example in the last number of months was the proposal to take away the 60 to 65 smart pass from the Department of Infrastructure. And, you know, that was framed as a transport policy and a transport benefit, if you like. But actually the implications of doing that would have massive knock-on impact on the economy, on childcare, on social connections, which is really important in terms of keeping people active. I went to a global ageing conference in Glasgow last year and listened over 3 days to speakers from around the world, all grappling with this issue of the ageing population. And it really struck me when I came away after those 3 days that the message was nearly the same from every country, that the main way to address the ageing population is to try to keep people healthier and active and independent for longer. That's the bottom line here. If you can keep people out of hospitals, if you keep people needing more healthcare, you have a much better chance of having a much healthier and an older population that can continue to contribute in so many ways. Mm-hmm. So for me, the current programme for government, that's a huge gaping hole in it that we don't have, that there's hardly any references to older people for a start. But I think it's a real omission not to have it as one of the top, what I would see as the need for a 10th priority in there to make the ageing population. The other thing I would just point out is that when I say the ageing population, that this is not just about older people. This is about everyone in society. This is about designing our services so we support people at different ages as they age. So it's not just an issue that it's older people's services. It's something that's going to allow everyone to benefit from a system that hopefully provides better healthcare, that provides domiciliary care packages that can reduce waiting lists, that allows people to get out and about and connect to their peers, to reduce loneliness and isolation. And we know a lot of evidence around that and the mental and physical impact that has. So it's looking at all of those in the round. And my plea to this committee today would be to really listen to my statutory advice to government. My office has provided the report, outlined, you know, our case that we think is a very strong one. I have spoken to many older people and older people's organisations over the last number of weeks as well, who are frankly appalled with the lack of representation in the programme for government. And I think we owe all of them. It's a real disservice if this message isn't heard. I'm pleased that they have Gavin from the department, who's going to brief the committee later today on the feedback that he and the team have got from older people. But I'm saying that, you know, there's a strong sense out there that older people feel ignored in this document, and also feel that their role and the positive role they play in society isn't being properly recognised and respected as well. So that would be my plea as a really important scrutiny committee, that you consider those points in relation to your role in holding the Executive Office to account on this. So thank you for the opportunity.
Okay. Thank you. Would you like to make any comments at this stage, or you okay? Okay, well, thank you so much, and thank you for keeping your comments brief. More time for Q&A. So I was doing a bit of research before we came to committee today, and I was looking to see whether there was an active ageing strategy, and I could only find one 2016 to 22. Is a new one coming, or did I miss that there is a new one? Because I think that a lot of the things you're highlighting.
Yeah, I think, if I'm being honest, that has been a real disappointment, that the active ageing strategy. It was set up a number of years back, right back. I remember being involved in an advisory committee with the first commissioner was involved in that. I think it's fair to say that there's been very little significant progress or outcomes as a result of that strategy. I'm not sure what the status is at the minute with it. And I think that's probably why the issue around the PFG is even more important, because there is a lack of, we haven't seen, you know, that strategy really deliver anything meaningful over the last number of years.
Okay. Well, thank you. And I suppose I should have highlighted that it's a Department for Communities strategy, so it's not actually the purview of this committee. But I think that if there was a strategic framework bedded in across the departments and with that sort of title, then I think that would be. So that's why I was asking that. So just the two other ones from me. So you talked about a health service in terms of not planning for an ageing population, and so I was then thinking, is that really around like core posts like consultant geriatricians, or, you know, is it as down as deep as that in terms of training of adequate staff in that field, or is there a more fundamental proposal you would have?
Yeah, I mean, the workforce planning is a key part of that, because what we're seeing, you know, across the health system is pressures everywhere you look. You know, the reality is we don't have enough doctors, we don't have enough nurses, we don't have enough care workers. The biggest issue that has come to my office over the last 2 years has been the lack of domiciliary care packages. That's a major crisis in parts of Northern Ireland, where people, you know, and it's not even a money situation, you know, it's a situation where we don't have the carers there to provide the services. So for me, this is where these things fall down when you don't have this focus, because to me there's an opportunity there to create jobs and employment. You know, thinking, well, this is going to become a bigger issue. There's going to be more people who need this level of care in future. What's that going to look like? People want to stay at home as long as they can. They want to stay independent, but that does require, you know, I remember, to quote an old friend of mine who sadly is no longer with us, a retired nurse down in Fermanagh, and she always talked about the need to really recruit an army of carers to support the ageing population. We just don't have people on the ground able to do that, and that's a gaping hole. But if you look at even across the health service, there's big issues there still with the likes of GP appointments, and, you know, the model that we have moved to since COVID is it's everywhere I go in Northern Ireland, the issue of GPs comes up, and the fact that people say, you know, I can't get an appointment, I can't see my GP face to face, you know, I'm having to explain my medical conditions to the person on reception. You know, those people are trained, but that's not communicated to the person. So there are all those issues, and that's even before you get to the stage where you have hospital admissions and all the backlog and the emergency departments and the waiting lists and all of that. So to me, none of that's going to get any better without a focus on the ageing population, you know. And to me, that would have to be the starting point to say, how's our society going? What's it going to look like in 5 years? What is the best way of meeting those needs?
Okay, thank you. And last one for me, it's in relation to the older workers, and you used the word barriers a couple of times in your report. They're facing barriers, and that people are saying that they don't feel that they're provided with enough support. Could you give maybe some examples or give a bit of context to those comments? Thank you.
I think this is a big area of potential. A lot of older people over the years, and I've been 16 years now in this sector, and I've heard a lot of people say to me that they would have stayed on working longer if they had more flexible options to do so. So I think we're missing a trick as a society, as a government, as businesses, that there should be more flexibility for people to, and this comes into issues around pensions as well, because a lot of people would say, well, I would take a part-time job or do something, but that'll actually affect my pension. And, so there's something about making more flexible employment options available for people. There's a lot of people out there still willing, there's a lot of people very, are down to retire, don't get me wrong, but there's an awful lot of people out there who would like to work longer but don't feel that they can work full time, or would like to work a bit and provide some childcare. And I think there is some good work being done out there. I mean, I know EJNI and the business and the community had a project on this, which I think's come to an end now. But I think there's something there, we're looking about the workplace and looking about attracting older workers. The other thing, just to mention in that, there's definitely an issue around age discrimination. There's research to show that once you hit 50, which is personally scary for me, who's out of a job in a few weeks, it becomes a lot harder to get employment, and I think that's something we need to look at as well. And I think it doesn't really make sense because you're actually looking at a group of people who have a huge amount of experience, and I think as a society we need to start thinking about our older workers and what they bring and what skills and experience that they have as well. And I think that's an opportunity for society.
Okay.
So can I just add to what you said, Eddie? We have an issue with economic inactivity in Northern Ireland. That's pretty clear. In the last report from the Northern Ireland Chamber of Commerce, it was shown that around 3/4 of employers in services faced recruitment challenges, 78% of those in manufacturing. So this clearly in the program for government, the issue of economic inactivity is addressed. 1 out of 3 people between 50 and 64 in Northern Ireland are inactive. So we need to think, what's the problem? Because people between 25 and 49, that number reduces to 16%. So one of the reasons that, according to the Labour Force Survey, some of the reasons why people are inactive, or the most important ones, are providing care that Eddie mentioned, and disability. And that's quite remarkable, because the disability-free life expectancy is the highest it has ever been in Northern Ireland, and yet people still don't work over the age of 50, between 50 and 64, because of disability. So we need to think about what's happening in the workplace that is stopping people from work. People who are generally more healthy than they used to be, they are not able to work. And in terms of providing care, what the stats show is that the older people get, the more proportion of people have to provide more than 50 hours of care per week, which basically stop anybody from working. So we probably should think about how can we support people who has that burden and cannot contribute economically, because they have to provide care. So those are some of the barriers. Other ones Eddie has discussed, especially age discrimination. There are reports which say that I cannot mention specific ones now, but they are included in the evidence that we submitted. That employers find it difficult or are worried to hire workers older than 50. They prefer to hire younger workers. This is probably because they think that they will have more opportunities to provide training in the workplace, and older workers are more likely to leave soon. But this is, I think, something around culture that also we could all contribute to change around the culture in the workplace.
Okay, thank you. Deputy Chair, please. Thanks.
Yeah, thank you both so much for coming in. I wanted to kind of pick up where Paula talked about healthcare, and you'd mentioned in your report that the Department of Health is proposing 10 health service cuts, and I was wondering if you could talk a bit more about those and what those 10 are and the impact they'll have on older people.
I can talk about, yes.
Yeah.
I don't remember the 10 of them. I can discuss some of those that specifically impact older people almost exclusively. The department's budget clarifies that most of the cuts that are proposed will affect older people disproportionately because older people are higher service users. So therefore, when you cut a service, it's more likely to impact older people. Some of those that are more specifically targeting older people are the service reductions in vaccine programs, the reduction and the cuts in care packages, or the reduction of acute hospital beds. All of these impact older people almost exclusively. The point that we were trying to make really in our response to the draft program for government was that, and by the way, in that actually, I forgot to mention, in that budget it was said that the waiting list initiative would also be reduced to half. I don't know what the status of that is at the moment. But the point that we were trying to make in our response to the draft program for government was that if one of the priorities of the executive is to reduce waiting lists, because the outpatient consultant waiting lists have increased between 2009 and 2023 on a 453%, you are not going to do that if you cut vaccine programs. So that's why it's important, I think, that the point that Eddie was stressing of looking at things through the lens of an aging population. Because we have more older people. In the department's budget, it is being clearly stated that older people are more likely to have health problems, health issues. They bring pressure to the service. If you reduce things like vaccine programs or care packages, it is very likely that next year you will have more demand, not less demand. And it's, we can be pretty certain that next year you will have the same problem or even a bigger problem that you have this year in supply outpacing, demand outpacing supply. So that's the point we are trying to make around health services, that we can have a priority and say in the program for government that we want to reduce waiting lists, but if we don't address the issues at its root, this is not going to happen. So that's why we are focusing on looking at things through the lens of an aging population.
Thank you. My next question then was really about the legal discrimination against older people, and I'll be fair to Claire, has done a lot of work on this in our committee, and I know she's considering legislation on this, but I was hoping you could talk a bit more about the impact you feel that's having on equality law in Northern Ireland and how we're lagging behind.
Yes, I mean, this has been going on now for 15 years or so. Northern Ireland remains the only part of the UK or Ireland that doesn't have age discrimination legislation in relation to goods, facilities and services. So what that has meant has been that older people here don't have the same protection. And the two main areas where this affects people are in healthcare services and financial services. So you will see examples of, and you'll hear this older people talking about, where they hit a certain age, that their insurance goes through the roof based on their age alone. Because that legislation was brought in GB, there's a different onus on the insurance companies to have a proper reason for that risk and the premium going up. So you have to provide, the onus is more on the companies to provide a health or a medical reason to justify that increase. Where in Northern Ireland, you can just have a policy saying, you hit 75, we're doubling your travel insurance or your car insurance or whatever. The other issue is around healthcare as well, and we have had many examples over the years. And when I talk about this subject to older people, they sometimes don't think about being discriminated against in the health service, but when they actually start thinking back on their own experience, they start thinking, well, maybe the way I was treated by my doctor or my consultant, or the language that was used, did focus more on my age than my ability to get treatment for an issue or to recover. And I always hark back to when I used to run the Northern Ireland Pensioners Parliament, and we had Professor Mark Lawler from Queen's University came, and he's a cancer specialist, and he did a very powerful presentation where he fundamentally believed that a lot of older people in Northern Ireland were being denied cancer treatment based on their age alone, not on the basis of them being able to have the treatment and have a chance to get out the other end and recover from it. So that is the seriousness of this gap in the legislation. But I'll give you one example that really highlighted how vulnerable the people are here with the lack of this legislation. During the pandemic, in the early weeks of the pandemic, all of the health authorities across the UK were coming up with different action plans. There was plans around hospital admissions. There was ethics committees that were drafting admissions criteria. And at the time I started working with the Welsh Commissioner, with Age UK, Age Scotland, Age Cymru, right across the board. We were starting to meet on a weekly basis to discuss what was happening and to share learning and trying to find out how best to protect older people. But during that process we came across draft admissions criteria from ethics committees in parts of England, where we were seeing plans being drafted that showed that the admissions criteria was going to include things like, we're not going to admit somebody over 70 to hospital in COVID. If we get to a stage where we're overrun, we're going to have to cut off at that age. And as a collective, we wrote a letter to all the trusts across the UK advising them that under age discrimination legislation that it was unlawful. Now, I signed that letter, but I knew Northern Ireland wasn't included in that. But what that actually meant was, what could have happened in Northern Ireland was there could have been a decision taken that anyone over 60 or 65 or 70 wouldn't receive hospital treatment if they got COVID. So that showed me just how serious this gap in the legislation is. And it is something that affects older people's lives. As I say, there's a lot of older people who I know who've had to give up driving because they just can't afford their insurance premium anymore. So if we're looking at an ageing population, this is the sort of a piece of legislation that we really need into place to ensure that those older people who there's going to be more of in society have the protection in place than every other citizen across the UK and Ireland has. So that's why that piece of legislation really is important, that gets through the Assembly, gets the agreement in and get those protections in place.
Thank you.
Okay, thank you. So I'm going to Carol online, please. Thank you. Go ahead.
Thank you, Paula. Thank you to the panel. I suppose, where or what department do you think should bring that? My first question is, what department do you think should bring that age discrimination legislation forward? And have you presented a draft piece of legislation even to whatever department? That's my first question. The second one is that the PFG proposes to have a 235 million transformation fund to improve public services. What would you both like to see included in that plan, particularly to support older people? And Chair, my last question is in relation to housing. There's been a lot of discussion around health, and rightly so, and social care, and rightly so. But what discussions have you had, if any, with the Department for Communities regarding prioritisation of older people within the provision of housing? Thank you.
Yeah, thank you. In relation to the legislation, I would see that as being a TEO responsible for that. It would have been previously agreed upon back in 2016, I believe, when it was OFM DFM. So it would sit very much with the Executive Office. In terms of the public services and extra money, well, where do you start with where you could put it? But there are, obviously the health system requires huge investment, and but I think it's probably you know, the focus on more support for preventative measures for me is one of the big areas. You know, I think if we're looking to keep people healthier and active for longer, then we have to provide the things that allow people to do that. And you know, this is not rocket science. People need to do, it's normal life. What do you need to do to have older people aren't different from any other age group. You know, they need to have a few pound in their pocket to be able to do things. They need to be able to get places. So that's where the likes of the bus pass is so valuable for people. Meeting up with friends, you know, you can't underestimate the fact that that pass gives people a lifeline to enable them to get out and about, to go to health appointments, to go, you know, shopping, to meet a friend for a cup of coffee. That whole social connection side, to provide childcare, all of that is really important. And I think the transport network is really, really important as a way of doing that. I also think, you know, when we look at the types of, I think if we look at the issue of loneliness and isolation, that is something that has heightened since COVID. It was a problem before COVID, but it's a bigger problem now. When I go out and about and speak to groups, I hear that a lot of the membership of groups has fallen since, you know, the restrictions were lifted. And the two reasons for that was people lived for 2 years under constant fear. You know, they were told every day that they were the group most at risk from dying of COVID. And that fear factor built up over time, and there was a fear of coming back into society, and a lot of people just didn't come back out. But the other really sad thing that I've heard a lot with groups is people have just got used to not leaving the house, or used to not being involved in the community. And that has there's a lot of research to show if people don't stay active, both physically active and mentally active, they go downhill very quickly. And that is a problem for the individual, but it's a problem for society. We have to try to keep people as active as possible. And I think, you know, I've been working a long time in this sector, and I'm amazed with the work that goes on in local communities, how many local groups there are run by older people. But we need more options as well. You know, not everyone wants to join a group. Not everyone, you know, the range of things. It's why the Men's Shed has been such a great success, because when I started 16 years ago in the age sector, one of the things that came up when I went round groups was that they were doing great work, but 90% of them were women. And they all talked about, we try to encourage men to come out, but it's very difficult for men to come out. And those groups naturally over time probably did more activities that the women wanted. So when something like the Men's Shed came along, that really, you know, the response to that showed you that there is a real, you know, need for people to connect and, you know, have a bit of crack and get out there and speak to people. And the, you know, the health benefits of that and schemes like that are really huge. And I think there's a lot more potential across both, you know, government level, but also like a local council level, where those sorts of schemes can make a real difference. So it's a bit of a rambling answer, but you know, there's obviously a huge amount of areas that I think if you invest in the prevention side will have a really impact. In terms of housing, I would just say that this is something that we're a long way off providing a housing stock that again meets the needs of the ageing population, and it's a big issue. You know, we still have lots of older people living in houses that are too big for them, houses that are very energy inefficient, that they really struggle to heat, but they have very little options about downsizing. And I think there's definitely an area of the market where I think, you know, smaller apartments, smaller, whatever you call them, retirement complexes. I've been out to a few housing associations who have actually launched a few housing developments over the last few years, and they have reported that there's been a great interest in people, you know, selling their house and moving in there. There's a lot of issues around safety and security and feeling that moving into a more modern place reduce their fuel bills. You know, you can talk about the winter fuel payment if you want, but these are things that people are thinking about. How do they manage their budget, but how do they live in a community where they have contact with people, have maybe friends, and have a sense of feeling safe? And I think there's a lot of, you know, that's something that we have to work with developers on and say, look, again, back to the ageing population, there's going to be a lot more people of this age group. What products are you putting on the market that will attract people? And there's a cultural thing here too. You know, there is a cultural thing with people saying, I want to hold on to my house to give it to my children. I don't want to move out. But that's no good if they're sitting in a house that's worth a few quid, but you know, you can't heat it. And there's a lot of people out there who may be asset rich but income poor. And, you know, it's one of my big concerns for this winter. You know, thankfully up to now it's been quite mild, but I know the cut to the winter fuel payment will be devastating for so many people. And if we get a cold spell, that's going to be something that people are really going to struggle with. And, you know, I think that decision was a shameful decision. I think it's going to, you know, I would hope it will backfire, because I know the value of that winter fuel payment for so many people. And we have to remember that energy prices now are still at a higher level than they were 5 or 6 years ago. So, I mean, the one final point I would say on that issue, what really hit home to me during COVID was when I was sitting at home on my sofa working, it really hit me how quickly I got cold sitting in one place, and how much that you had to put the heat on to stay warm. And it really struck me that, you know, before COVID, we were all out working in offices that are all paid for and heated. And when we talk about people living alone, older people with health conditions, maybe no mobility, if you're sitting on a chair, you get cold very quickly, and it doesn't have to be cold outside. So that's why that whole issue is one that really greatly concerns me this winter.
Do you want to come back in there, Carol?
Sure, I just, you know, appreciate everything the Commissioner said, but there's 2 questions that weren't answered. First of all, did the Commission ever hand a draft sample of legislation to either FMD, FM or TO? And the second one is, I appreciate he's met the housing associations, but has he as Commissioner met with the department, the Minister for Communities, around ageing population and housing? If it means writing them with additional information, that's fine, because I appreciate there's quite a lot of time taken up just on one question. Thank you.
You want to respond to those?
Yeah, well, we would have fed in when the age discrimination legislation was being worked on. We would have fed in to work being done by officials in OFM, DFM. So it wouldn't be our role to obviously create the legislation, but we would certainly advise on it, and we would be very willing to work, you know, on that again. If that piece of legislation come up, we would be very happy to feed into it. We feel that you know, the bulk of that legislation is probably sitting there. You know, it's been applied in, you know, in GB now for 10 years. You know, it's something that could be picked up fairly quickly and then looked at it from a Northern Ireland perspective. But my office would certainly feed in to that and see, you know, also review how it's gone over that time and see whether we can make changes to it to make it better as well. The other question, I haven't met the current minister yet. I've met previous, you know, I've attended different events on housing at times and been invited to speak at events. Haven't met this current minister yet, although I'm due to have a meeting with him in a couple of weeks' time on the winter fuel payment.
Okay, well, hopefully I'll get a chance to raise that as well.
Yeah.
Okay, Claire, please. Thank you.
Thank you, Chair. Thank you, Commissioner. I'm conscious this is probably the last time you're going to appear before the committee, so I just want to put on record my thanks for your work as Commissioner over these last number of years. Obviously, I've kept a close interest on the work of the Commission and how you're advocating for older people, and I do share your concerns, particularly in relation to the lack of older people being mentioned within the programme for government, and indeed the age discrimination legislation for goods, facilities and services. I think it was Sir Chris Whitty had said something recently in relation to how we plan our public services, and we have to look at the demographics, and certainly we are an ageing population. So whilst there are direct reasons for wanting to include older people within the programme for government, there's very significant indirect reasons for which we include them, because our services will look very different if we're not designing them for the demographics that exist. You know, the pressures that exist within the health system, we may be living longer, but that usually means we're going to get ill and find ourselves within hospital more, and that's going to put more pressures on the system. So I do think it's quite a dereliction of responsibility that the government hasn't considered the demographics. They're failing to plan, and I think that's why we're in the mess that we're in now anyway. I suppose that was just a comment, but it's really just to, if there's any insights from other jurisdictions or from people that you've heard and worked with who have given examples as what we're setting ourselves up for by not putting this in the programme for government. In terms of the age discrimination legislation, I've written to yourself and I've written to others about my intention to bring this forward as a private member's bill. I think you've outlined some of the reasons as to why this is needed. I established the All-Party Group for Ageing and Older People right back in 2014. And, you know, there was conversations about it now, and it's still the ask that I get from older people in terms of what we can really do to help people. So I suppose it's critical that we could do it, and it's maybe more of an ask of all the committee that most of the committee members sit in the government where they have the ability to look at the programme for government and to ensure that we do actually give attention to a significant part of our population who are eventually going to be most of our population. So probably more comments than questions, Commissioner, but anything you want to respond to.
Thank you. Claire, go ahead.
Yeah, thanks for that. I mean, echo again the importance of the age discrimination stuff, but I think the question around other jurisdictions, you know, when I went to that conference last year, it was very interesting. You could see that most places are grappling with this issue of the ageing population. Some places are in a different place than others. I mean, there's some countries that are in a worse place than us. I mean, I was really struck by an Italian presenter who showed me the age pyramid in Italy, and it was really an inverted pyramid, which was frightening to see it, but it showed you just how little young people there was to support this growing number of older people. But there are things that are happening. I mean, myself and my policy team would be scanning to see examples of, you know, good practice. I'll give you one example that we came aware of a number of years back. We noticed that we came across that there was a scheme in Denmark, that a preventative scheme that they brought in, that every person, once they hit their 75th birthday, would receive a visit from a health worker, whether it was a social worker or a nurse, just to come out to their home. It was kind of a health check, and it was checking in, but the whole idea of it was to try to identify any problems a person might be having around that age, when the likelihood is you may have deteriorating health in some ways, different conditions. And they found it was effective in trying to identify potential problems. So it was small things at times. Sometimes it was it was identifying any worrying early signs of illness, but it was also things like identifying if there was any trip hazards in the house that they felt they needed advice on, whether the person needed a handrail, you know, if their mobility was, and they have actually did research to show that this was having an impact, that they could see that doing that visit at 75, and I'm pleased to say that there is a pilot happening in Northern Ireland on the back of that work. But that's just one example of, you know, where we're looking at saying, well, what can we do to try to improve things and keep people active in the community for longer? Sometimes it can be small things that make a difference to people's lives. There's other schemes that have happened as well. I know in the sort of Armagh area, there's been a sort of a pilot running now for a few years, where there's been a real push to provide healthcare at home, and instead of people having to go into hospital, that they're with technology changing, that there's more services they can go out and actually keep somebody in their house and provide a certain amount of healthcare treatment at home, and that actually relieves the pressure on the system. But also it shows you actually that the outcomes, the patient outcomes, are actually a lot better. There's a lot of evidence coming out showing that people recover from different illnesses much quicker if they're actually at home being treated than in a hospital setting. So there are things we can do. Obviously technology is changing all the time as well. Again, that's one side of it. We have to look, where can we be smart and use technology in the right way? But it has to be a balance. You know, it has to be a balancing act. You know, I've had GPs say to me privately that they are concerned by not having as many face-to-face meetings with people, because they know themselves that, you know, as great as it is to talk to somebody on the phone or by video, if the person can do it, it's not the same as face-to-face. And they would say that over the years they would have diagnosed a lot of things wrong with people that was nothing to do with the reason the person made the appointment in the first place, but they picked up from speaking to the person face-to-face something not right. So that worries me about primary care. It worries me about identifying things early, but we have to get the balance right. Yes, there's a place for technology, but also we can't lose the human touch in that as well.
Okay, thank you. Claire, do you want to respond, or is that you? No. Okay, thank you. Moving on then. So Sinead, please.
Okay, thank you, Eddie, and I just want to put on my record thanks for the work that you've done for older people in Northern Ireland and your passion for it. I want to kind of look at the work, economic inactivity too, because I really think that this is a real opportunity for us that we're missing. I know that you've talked about it, but I'm also on the Economy Committee, and a couple of weeks ago we got a presentation. It was a joint presentation from the Oireachtas and ourselves here. We came together and a paper was given to us from ISRA, and it was comparing and contrasting the labour market on gender on the Republic of Ireland and Northern Ireland. And the real stark difference in the two markets in gender was, number one, was women of an older age that were not working. The difference between that here in Northern Ireland and the Republic of Ireland was something like 16%. The gap was massive. So there was a lot of higher economic inactivity for women living alone here. And when we're talking about women in the labour market, so we're talking about women from 50 to 64. And, you know, same island, it can only be policy in and around that. And women were living in poverty as well at higher levels at that, because, you know, maybe they've been caring for children younger in their younger careers, and then they had less pensions and that. But there also kind of was a stark gap in that they were waiting on healthcare here. Long waiting lists, you know, for hip operations or gynae operations or whatever, and was really having a big impact. And when you're talking about, you know, the preventative stuff, you're talking about 75-year-olds, one of the areas, like they were talking about osteoporosis, and, you know, how do we prevent older people, but generally this was 15% of a difference for older women. How do we prevent them getting into that situation earlier on so that that doesn't happen? And they were talking about interventions like weights, you know, but for someone that is looking to the future, how can we be innovative and plan for that future, that it's a healthy future and it's an active future and it's a future that they can enjoy for a longer period of time? Because there is a definite gender gap here. It startled me, to be honest with you.
Well, again, I think it's a good question. You know, again, I would come back to sort of the main point I'm saying about, you know, when you're not prioritising this issue, it makes it harder to raise these issues up the agenda. So you're creating the space for that innovation and thinking and bringing people. I mean, I've been struck, you know, a lot of the times when I've been involved in events across Northern Ireland, particularly in the health service, and there's an awful lot of really good people who are really passionate about the areas that they're working in, you know, and they see things that can be done, and they see things that, you know, they've seen things working in pilots and stuff, but they have been frustrated at times that it hasn't really blossomed to be a more wider policy. And I think this is why I think all these issues here they affect so many people, and like every person who is sitting waiting on treatment for whatever it is, or an operation, that has a massive impact on that person's life and their family's life. We talk about the huge amount of, you know, hours that unpaid carers have to put in, and the knock-on implication that has for the workforce. And that's why none of these issues, I'm not saying these issues are easy issues to deal with, but we've got to realise that if we're going to start tackling the real problems that are there, we need to have that vision about how we want to live and as a society, and that involves, you know, everything. Yes, you need the funding and investment in the health service, but it is the wider stuff around it that you really are creating an age-friendly society that's supporting people when they need it. But again, it's back to the point about trying to keep people healthier for longer, and those underpinning policies that are so vital, you know, pensions policy, transport availability, like that's a huge thing. Transport has been decimated in rural areas in Northern Ireland over the last number of years, and a lot of those community transport services, you know, they are literally lifelines for people. You know, I was on the radio a couple of weeks ago talking about, you know, should older people have to redo their driving test and all of this, and but, you know, I think what people don't seem to realise, unless you're in that position, the fear that I've known a number of older people over the years who have, feared that losing that independence, because the impact that has on their lives is devastating. I mean, their life changes overnight. If you're living in a rural area and you can drive, and that's the only way you can get to the shops, to the doctors, to meet people, to go to meetings, if you lose that, then, and you don't have the money to get a taxi into the local bus station or the train station, that is a devastating impact. But those sorts of things are, they have to be brought up to say, like, why is there this major difference? What's being done differently elsewhere? What are we doing, and what can we do? Because
essentially people are the same, and it's silent, it's the same, so it has to be policy. So there is a divergence in policy in how we look after people. But that's what I'm trying to get to, Eddie, really, to be honest with you. I'm asking you, really, have we enough data? Is there enough data? Because even getting that report together, there was a divergence on how they got the data. The Northern Ireland data was really, really hard to get. And it was much, much easier in the Republic of Ireland. And the two professors that were given the briefing, they said, look, it's a serious gap. If you're planning for the future and you're planning a programme for government, you base that programme for government on robust data. And that's why you're providing the services, and that's why you're investing in the future. And we are, we've storylines, yes, and we have great gaps in those storylines, but they're not really all underpinned with the appropriate data to allow us to provide the services that are required to support people in a healthy, active ageing.
Okay, do you want to respond?
Yeah. Ask the Angel
No,
for that,
I
because
mean, we've been recently in touch with NISRA, because they recently, due to lack of funding, they had to discontinue the plan to create the age-friendly profiles, which would have been a very helpful tool to understand the aging population in Northern Ireland and the issues and challenges it faces. But I thought your example was really interesting, to the point we are trying to make. Obviously, I mean, don't expect that I can tell you anything about how to solve how to prevent osteoporosis. I cannot say that. I cannot.
That was just an example.
But I think it's really interesting, the example that you've given, in the sense of it shows that how these issues are interconnected, and that's basically what we came to do here was to try to send the message that if there's no integrated and coordinated approach, these issues are so interconnected that one affects the other. The example that you gave is fantastic. Women are not working because they are waiting for healthcare. But if women were working, probably we would be in a better position to provide healthcare for them. So one thing lifts up the other. So that's why what we are saying, basically, often, and we see this in our conversations with the Department of Health, we've been told over and over, and this has been included in the department's budget, we are just trying to stabilize the system. So basically, cover the gaps, cover the holes, and it's understandable. I mean, obviously, that's what you have to do when you are in that position. But seeing the trajectory that we are going to, that is not going to bring a meaningful transformation of the system. And a meaningful transformation is not only a problem for the Department of Health, it's a problem for all departments. It's also a problem for economy. It's also a problem for communities.
Yeah.
It has to be coordinated. And that's what we came here basically to say. Obviously, in some specific issues, I cannot give advice, but on the need to an integrated approach, that's for sure, yeah. So your example, I think, was very, very telling.
I suppose what we do have data on is the ageing population. We do have data on that, and it's very clear. We have an ageing population, and yet it wasn't addressed in any quantifiable way within the programme for government. Look, my party has been clear that there really lacks implementation and monitoring measures and smart targets in the programme for government overall. Would you be concerned about that?
Yeah, I mean, absolutely. I mean, there's not anything that specific and detailed in it, and that is that's something that maybe it's the next stage, that we do that, but that's a concern, and I suppose at this stage, you know, when you look at the lack of detail and targets that is in the current draft programme for government, that made me even more disappointed that we couldn't even get a commitment to the ageing population in this document. And I just think all the issues we have talked about here today, I mean, the bottom line is none of them are going to get better without a renewed focus on these issues. They're not. We stick our head in the sand on these issues, they're just going to get worse. But there are opportunities within the ageing population if we grasp them. You know, we talked about the economy and the impact, and if we do things smarter, you know, we can see things happen. I mean, the bus pass was a good example, because when I met with the Department of Infrastructure, you know, some of the arguments that I was getting back on it was, you know, well, you know, our bus pass is more generous than in GB. And I said, well, that's not a bad thing. In fact, you know, I know the problems in GB because I know many older people's groups there complain that it's only off-peak hours, which means they can't use the bus in the morning to travel to their daughter or son's house to do the childcare. They can't go to the charity shop to do their volunteering. You know, the things, it's not the bus pass and the cost, it's what people are using it for, and they're getting out and about and they're keeping themselves active. And, you know, yes, we all like, you know, we all in Northern Ireland like a freebie in that sort of sense, but that's one of the really great things about it. It encourages people to get out. You know, it actually, people who, one of the arguments the department said to me was it would save this amount a year. And I said, that's absolute nonsense. Yeah. You're basing that on the fact that those millions of journeys will still be made and people will pay for them. No, they won't. They'll either get in their car or they'll stay at home. Both those options are bad for society, because if they stay at home, they're not out and about, they're not staying active, not doing things that all the experts around the world are saying you have to do to support an ageing population. If they get in the car, you just make congestion and pollution. And I pointed out to the department, it was their responsibility for looking at things like pollution and congestion as well, that policy change was actually going to actively negatively impact on other parts of the department. So it's viewing all of these things, and they are all connected, you know, and that's one of the things that I've seen through my work. You know, the people's lives are all connected. People's lives aren't determined by just policies in these areas. You know, everything, even from the fact, take something like fear of crime. People's fear of crime goes down if they've got contact with their local group, older people's group and stuff, somebody they can go and speak to. If people get isolated, they're living at home, they hear stories, they watch the news, they see people being attacked, that fear level increases. But being out and about and speaking to people and being part of the community actually reduces that. The other thing I would say about things like the bus pass as well, if people use it to manage their energy bills, people use it to get out of the house, and there's, you know, that's one of the things that people have always said for me for years, that they get out in the bus, so they're out of the house for a good bit of the day, so they're not having to put the heating on so they can manage their energy bills. One of the big complaints that came to me over the years was, which I was always taken aback by, was older people complaining about chairs and benches being removed from shopping centres, because they wanted to stay out of the house as long as possible, so they went shopping, but obviously they needed to rest, and shopping centres started copping on that these people are in our stores, maybe not spending as much money as we want them to spend, so we'll take out the benches so they're not. But wee things like that really matter, you know. So, you know, we're talking about a whole range of issues, but I suppose the point I'm making is they're all interconnected, and actually all these different policies, and that's why I think the programme for government, with that focus, it means that all the departments are thinking, well, how does that policy of ours actually impact on economic policy or health or transport? And we're not making those decisions that actually have unknown consequences.
I have a question at the end. I want to come in on that. But Harry, please go ahead.
I appreciate it. And Commissioner, first of all, can I say what a day for aging and older people when a 78-year-old can become the President of the United States of America. Wow, it just shows you what can be done. Commissioner, when you had a look at the programme for government, and you said on the lack of a plan for aging and older people, and your view after going through it all, how would your plan look?
Well, I suppose it's everything that I've talked about today. I would make a very sort of ambitious plan to say, you know, Northern Ireland has become a really good place to age, and we need to create conditions. And then you're looking across, well, what does that mean? And it means good quality of life. It's about healthcare when you need it, trying to stay healthy, trying to stay well connected, having being able to be part of society for longer, and looking at the policies that you need and to support that more. And it is as simple as that. There's a lot of this stuff that older people need. It's not rocket science, it's just the stuff that any one of us needs. We need a roof over our heads, need to be able to, feed ourselves, to have social connections, support when it's needed, whether that's healthcare support, whether it's benefit support. And it's those simple things that contribute massively to quality of life. I mean, I've known lots of people over the years who made the call around pension credit, and people have told me that the difference that made to their quality of life was incredible, because they suddenly had this amount of extra money every month, and that literally changed their life. They were able to do things, they had to be able to go out, socialise, they'd be able to do things they just couldn't do before, and the health implications for that was huge as well. So it is about creating, these are big challenges, but the data, we could have a lot better data. We've been surprised over the years when we have asked for breakdowns of data sets, and it has been alarming when we haven't got them, because you're thinking, well, how are you making decisions? How are you properly planning without that? But what we do have the data on is clearly the ageing population. It's no secret. It's been coming down the line for a long time. We're in the middle of it now. It's not something that's 5 or 10 years down the line. We're in the middle of a rapidly changing part of society, and it's that thing about looking at everything, saying, look, if 1 in 4 people are going to be over 65 in our community in a few years' time, then we need to reflect on what that means for us all. And until we start thinking like that, then we have to start thinking, what type of society do we want? What type of services do we want? How much does that cost? Let's get real. This costs money as well. But there's elements of it that isn't very expensive. There's things that can be done in terms of policy and practice that actually can help people. There may be areas as well that we're investing in that isn't effective. Do we need to change our approach in certain things? So, I've always been, feeling that when I see the impact that community groups and local groups and volunteers do in the local community, they struggle to, I suppose, quantify the impact that has. But I know from many years working with this, the impact that being able to go out to your local senior citizens meeting once a week or once a fortnight is, the impact that has on people is huge. And it's not just for the hour or two they're out at the meeting. So many people over the years said that keeps me going. Something to look forward to. Something to have a bit of crack, learn things. I feel if I have any worries about stuff, I can speak to somebody the next time I'm going out. So that's something that they're running the shoestring. Usually the members throw in £1 or something each week or something. But actually, that sort of stuff can actually really help communities. And I've always felt that if you took away a lot of those volunteer groups, the impact of that would be massive. It would really be massive. But sometimes those groups need a wee bit extra support as well. And I was always, wanting funders to maybe provide small grants to allow, groups to do a wee bit more, go on trips, go and do the odd thing. It's one of my frustrations, and I've sat on funding committees myself, where you'd need a degree in applying for a grant. You're doing like a 20-page application for £1,000 grant, and all these checks and balances, and groups are saying, we can't do that, or it's too much hassle, or I don't want to be lumbered with responsibility. We've got to look at where we invest, and we look at the impact. But for me, it's about impact. It's about having policies and practice and legislation that actually delivers, and keep that under review, so we know we're doing the right things.
Commissioner, would you agree with me that the population differ on their views in retirement? Some wish to retire early, stop, to go and do, they have a vision of what they want to do. Others wish to keep on working, and it's provision for this is key. And like affordability for the company, we do have to keep in mind. Well, you did mention that yourself, Chair.
That's a really good point, because older people are like any other age group. They're all different. They all have different interests. It's one of the things that I mentioned about the sector being very, for years very women orientated. So a lot of the groups just naturally grew, and and then there's a lot of older people out there who don't want to be joiners of groups as well. We're all different personalities. Some people are introverts, some people are extroverts. People want to do certain things. Some people want to work in a men's shed. Some people want to be on the golf course. Some people want to
president.
yeah. Well, some people want to be president. But what you do, what doesn't change is people have an interest in something. So it's about having that suite of options for something. But people are all different, and people's views. And the other really interesting piece of evidence that came up at that event I was at was that it said that the biggest impact on your life expectancy as you age is your attitude to aging. They said that if you have a positive mindset into going into aging, there's a lot of research now that's showing that actually has real implications. And I think there was one of the speakers actually said there was evidence to show that people could be living up to 7 years longer with having a positive mindset to aging as opposed to a negative mindset. And that really struck me, because I thought to myself, well, that then you're getting into communication and messaging and about aging. And I think that is an issue as well, because if you're turned on the TV and radio and all you hear is waiting lists and all the negative stuff and all that, you can get people saying, oh God, I'm getting older. And we all say it and joke, but a lot of people worry about that and worry about what they're doing. But at the same time, what I've noticed now, that there is a generation now of older people who are really, active and, engaged in their communities. And, I know my mum's in her mid-70s, her and her friends, they've better social life than me. Like, they're out in a meeting 2 or 3 times a week for a coffee down the hotel and all this. And when I go out and do events, sometimes you come across groups of older people and say, we don't feel old, we might be late 70s, but we've a really, we're going to, local U3A, we're learning new things, we're doing things, we're looking after the grandkids. There's a lot of older people out there with a real positive approach to aging. And I think that's something that's really, really good. And, I always think back, when I look at my mum now, and I look at my granny when I grew up, it's always something that sticks with me. Well, I always remembered my granny as just this, wee old woman who just sat in the corner of her house, saying her prayers and didn't do much and didn't go out and do whatever. And when I look back on that now, it's actually frightening that I always thought she was, the ancient.
Was your age?
But not quite. But when I look back now, she was much younger than my mum is now. And when I compare that generation now to that older generation where, you sort of, her husband died, it was kind of, that's your place. There is a lot of positive things around aging that older people are saying, no, we're going to enjoy ourselves, we're going to, we're going to spend the inheritance, we're going to keep active. And that's really good. So that's the other side of it. But I think that's the part that you can see if you're actually given opportunities for people to stay active in society. That's a really good thing, because one of the quotes that always stuck in my head was an ex-chair of mine from my last organisation, and he said after he retired, he worked for 40 odd years, and he said that he really felt that he was somebody on a Friday and nobody on a Monday. He felt that when he went retired, he kind of lost his purpose, his position, and he said for a couple of years I just really struggled with retirement. And then he started getting involved with organisations and campaigning and all of that. But that always struck me that, there's a lot of things that we could be tapping into there, that older people, and I know my last organisation, the strapline was speaking from experience, because the wealth of experience that people brought on different issues, they all came from different careers and backgrounds and whatever. And I learned so much from them, but I thought to myself, there's so much untapped potential here. If we were just, instead of, writing people off, you retire, that's it, you hang about, until the end of your days. But actually not, there's now a longer period of retirement. And I think that's something as a society we need to realise now. People are living a lot longer in retirement, and how do we tap into that and actually give people options to contribute? So That would,
Commissioner.
I'm not sure if that answered your question or not.
No, it's
but-
very good. And I don't want to ask another question, Chair, but one concern I would have is the lack of carers, but
Oh yes,
And
I think
maybe-
you'd address that a wee bit around.
it could be maybe addressed. I don't want to
Yeah.
take
Do
any
you have
more
something
time.
quick you want to respond to that?
Yeah,
maybe?
that's one of the biggest
Yeah,
issues. I
that's
say
one of
it's the
my
biggest issues coming to my office the last 2 years.
Yeah.
It's a real problem, and we just, we need to make those jobs more attractive. We've got to, this is about terms and conditions. They are hard jobs, and we're paying people less than people getting a job in Tesco. And
Are you maybe
and-
talking about unpaid carers, like
Both.
families?
Both.
Okay, okay.
Yeah,
Because
yeah.
that's another aspect I'm
Yeah.
not
I
sure
think
you
the
addressed.
unpaid carers, there's a need for definitely more respite for people as well, because there's I mean, we all know there's so much unpaid caring goes on, and families, by and large, are pretty good at that, but it's a huge burden on people too. And I think a lot of people are willing to provide it, but it's the lack the lack of respite care is a big issue too. And I think that's something that again, needs to be looked at. Because this is again just going to be with the demographic shift, it's just going to become a bigger issue for more people.
I'm going to need a lot more of them.
Yeah.
Sorry, Chair.
No,
Thank
that's
you.
fine. That's fine.
Appreciate
That's a
it.
good
Thank
point
you.
at the end.
Thank
Thank you. Timothy, please.
Thank you very much, Chair. Eddie Angel, thank you very much for coming along. It's been a very, very good evidence session, good briefing. It's been honest and frank. One of the words you mentioned at the start was flabbergasted, I think, when you seen the programme for government. I suppose picking up there, you produced a detailed paper. You met the ministers, you met the junior ministers, you met officials, you drafted suggested points to include in the programme for government, and provided strong evidence base for inclusion of them points. Looking back on it now, do you feel as if you wasted your time engaging? Or, I'm just trying to get your experience, because obviously you've been very proactive, you've been very good at bringing forward the information, and I feel you're very deflated when you look at the book of what has actually been included.
Yeah, well, I'm bitterly disappointed about. It hasn't been a waste of time, because it's frankly it's our job, and if we're not saying this, who is there to say it? And I take my role seriously, and I just feel that I'm really frustrated by the programme for government, and there's a huge amount of work my team has gone in, as you mentioned about that. I feel that the evidence base is there. I think these issues that we're facing are in plain sight. These are not. We all know the problems that are there, and when I look at that programme for government, I just look at it and say, how is that going to make things better? You can make statements about let's improve the health service, but if we keep doing things the same way, we're not going to get better outcomes. If we keep doing what we've been doing now, as Angel says, it's just patching gaps in services, but that's not sustainable. The issues that we're seeing every winter have been getting worse and worse, and unfortunately, it's entirely predictable. And what we are saying is, we can't just keep going down this route. If we don't look at this and say, the ageing population is actually one of the primary causes for the big issues that we're facing in society. I mean, people are just fearful now of getting sick, frankly.
Mm-hmm.
People are fearful. We've all heard the horror stories about, sitting in emergency departments, never mind even emergency departments, sitting in ambulances for 10 or 12 hours to get a minute. And people are frightened to get sick during the winter because they know what they're going to face. So it's deeply frustrating for me. I've been talking about this for some time. For me as commissioner, some things we've made progress on over my time, but it is a frustration that this isn't being recognised as a top priority. And I don't believe, frankly, if it's not one of the top priorities, it's not being given the position it needs to be in the programme for government. I don't think. We all know the way government works. We know the way things flow. If you don't have a high level priority, then departments will not be focusing on that. And I think if we're going to get all these things, if we're going to get a lot of those things right in the programme for government, we're going to have to look at it through the lens of the ageing population. Because if you do that, I strongly believe you're setting yourself up for failure. You'll be sitting here in 5 years' time with the situation even worse. And, you know, the time has passed not to take this action. I know it's not an easy thing to do. I know it's a challenge. But my call would be for this Assembly and the Executive to be saying, we recognise where the challenge is coming from this. You know, I've spoken to, you know, and I don't want to focus entirely on the health service, but I've spoken in my role to health professionals across a range of disciplines over many years. And they all know the problems, they know the issues. I mean, I've been invited by chief executives of health trusts to come and visit emergency departments because they're open and honest. They're saying the services we're providing now aren't fit for purpose, aren't meeting people's needs, and are crying out for help, frankly. And, you know, I feel sorry for the people in the health service as well who are working in these conditions. You know, that they saw us through COVID, the pandemic. They went above and beyond. But we are now asking our health workers to do a nearly impossible job. And, you know, where does that break? Because, you know, you'll start getting to the point where people will not want to go and work in the health service if it's under so much pressure all the time. That's one of the things I'm hearing. Why would you go in there? And then you're in a bigger problem. We have already seen it. Carers is the first example of a massive gap. You know, where's the attractiveness of going into that area of work? It's a hard job. For many people, it's like a vocation, really. They want to do it, they want to help people. But we need to start getting to the stage where we're treating those people better and giving them better terms and conditions and attracting people into the health service to work, because we need them. We need them. And at the minute now, I mean, I've had so many cases where people are ready to be discharged from hospital and are having to go into a care home because there's no care package in the community. And they are fit to stay at home, stay in the community, but they need somebody to come out 3 times a day to help them. But there's nobody available to do it. And they end up in care homes. And, you know, the impact that has on people's, and I've heard terrible stories of people's mental health going downhill within weeks because they don't understand why they don't know whether they're getting out again, you know, and that's the reality, you know, of what's happening. So it's a bleak picture, but it's not all bleak. You know, there is positive sides from the ageing population, and, you know, I've touched on some of that today. But
sure,
my point,
I just ask, you know, regarding your communication with the Executive Office, so you're very passionate, you're very knowledgeable across this brief. How easy or how interactive did you find it to engage with the First Minister, Deputy First Minister, junior ministers and officials to try and get this message across to them? Was it an easy process? Did they reach out to you? Did you reach out to them?
Well, I requested a meeting with the First and Deputy First Minister. In fairness, I got that meeting fairly easily. Had the meeting, I mean, I would say overall, I felt it was a fairly positive meeting. Met with both the First and Deputy First Minister and the 2 junior ministers in the Executive Office. You know, we presented our case. You know, I think sometimes this is the frustration for me. You know, I didn't feel there was pushback on what we were saying. I think, you know, there was acceptance that the issues and the points we were making, they recognised they were big points for society. You know, from my position, I'm not sure what else we can do. You know, I've been outspoken on this. I've spoken at events. We've put in I think a very good written response. We've told the ministers about the need for this. You know, I've done media on it, and you know, come here today, and I just, you know, I do feel I am passionate about this because I see the outcome of this. If this isn't prioritised, I see what's going to happen. I see what's coming down the line, and I don't understand why the ageing population wouldn't be in there as a top priority.
You've mentioned in your evidence that older people are being seen as a burden rather than valued. You've listed many ways when it comes to housing. We've talked about discrimination legislation, health policy, different things. if you were to leave one thing with committee today on one area that we could focus on to make it better from a Stormont perspective, what would that be?
It's very hard to focus on one area. I mean, I think there's so many factors that affect people. It is hard to boil it down to one issue. I mean, probably the health system as it stands and the impact that that's having on tens of thousands of older people's lives is the single biggest thing. But I know that's only going to be fixed by major investment in the health service, and that's a challenge. I know that's a challenge. For me, the smarter approach is the preventative approach, that we're prioritising that, so we're not ending up with all the pressures in the hospitals and in the waiting lists. And like, it's not going to be an overnight fix, but that's, to me, the approach that needs to be taken. I mean, it struck me that Professor Bengoa was back over here a few weeks ago, and he was talking about the reform of the healthcare system, and some of the stuff he said in his interview, I just thought, exactly what we have been saying. We have to change things. We can't keep doing the same thing. It's not working, it's not sustainable, and it's affecting people's lives. And I've seen too many cases of people who end up living the last years of their life in a way that it shouldn't be the case here. We should be able to be better at providing services for our older population. Mm-hmm. And we aren't, yes, money's tight, but we're not the poorest country in the world. There's things we can do better. There's definitely things we can do better. But I think there is a cultural thing that we have to look at our ageing population and focus on that and say, are we doing enough to actually make them a priority?
And just to bring my questions to an end, so the reflection that I have from what you've said today is that, to boil it down, the Executive Office or the Executive First Minister, Deputy First Minister haven't listened to what you put across, and the Department of Health in its current state is failing older people. Would you agree with them two statements?
Well, what I would say is the consultation finished on the 4th of this week, the 4th of November. What I would say, the First and Deputy First Minister came to the event in the Long Gallery and said they were here to listen. It was very, the older people who attended that event, the older people organisations, were very adamant about their views on the current draft programme for government and how it wasn't fit for purpose. And I hope, I've been told that the consultation process is a genuine process where the ears are open to about what needs changed, and I just hope. I know a lot of older people's organisations have put in responses to this. I know there's been a number of events with older people, but the current programme for government is not fit for purpose in dealing with our ageing population, and I think the only way it can be is if we get that 10th priority in it. And I just fear that if that change isn't made, I don't think the voice could have been any louder and the feedback could have been any louder in this. And I will certainly ask the questions, if after this consultation period that statutory advice from myself as Commissioner isn't taken on board, then why?
Thank you very much.
Chair, thank you. Brian, please.
Hey, look, thank you for your evidence today. Both of you, our time's already over. But I appreciate how you've related your comments to some of the priorities in the programme for government over health, economy and housing. Certainly I am concerned what you're saying, that there's not enough focus on older people in the document. We have officials coming in next, so we will be able to raise that with them directly. I suppose it might be said that the programme isn't devised around sections of society as such. It's themes that apply across society. There's not a section on disability or ethnic minorities or different age groups and so on. But still, we will want to see delivery for older people, and you make the point about our ageing population. So in the outworking of this and in the annual report that's to be done on the programme, and it's only for the next 2.5 years, but we want to see that priority in that. So I'm just mindful of our time, but just one other thing I would like to ask you about is intergenerational activity. That's something I'm concerned about. You mentioned about attendance at activities, and we saw that in churches. Many churches are in attendance, and I think churches had a particular role in other faith-based groups, bringing people together across generations, and I feel that has declined. And I think that's very important. If you live in a small community, you have the opportunity to get people to know people across generations, but many people become actually isolated almost within their age group, outside of their own family. Just if you have any views on that about promoting intergenerational contact?
Yeah, I mean, I think there's a lot more that can be done in that area. I mean, I've had some experience of working with the likes of Lincoln Generations, NI and stuff over the years and different projects. What's always struck me has been any event that I've been at where you've brought older people and younger people together, has been the amount of agreement amongst them, and actually how much they enjoy the experience. A lot of older people do like engaging, with younger people as well. A lot of older people are about learning new things, they hear things, and there's been so many good projects where older people learn things that they hear, and I've always seen those events to be really positive, with the young people as well, and like I've always been struck by the amount of respect that younger people had for older people at those events. I mean, I remember doing ones on things like the bus pass years and years ago where they talked about, concessionary fares and who they should apply for. And it really struck me, that the younger people at the table I was at were all, so passionate about the bus pass for older people. They thought it was great. They were saying, they were more advocating it than the older people. They were saying, yeah, I think it's a great thing. You've worked all your life. You've done all these things for society. I think it's a really good thing, to get in later life. It was really, but I think there's a lot more that could be done, I think, on the intergenerational stuff. I don't think there's been a huge investment in it. I think where it's been done, it's been sort of done organically. I think any experience I've had where you bring people together of different ages, it's nearly always a very positive experience. And and I've been at some really great projects as well where care homes have brought in young people from schools to do different things, and I've seen I've seen care homes doing great things, like doing a festival over a couple of weeks where they do bring people in, that the home isn't removed from the community, but they're trying to make it still part of the community. So just because you're living in a care home doesn't mean you're detached away. And I've seen some really good examples it's been really nice to see that engagement. So I think that is something again that there's a lot of benefits there from, and I think younger people, and include myself in this, I have learnt a lot working with older people over the last 16 years, a lot, and I've had great fun, and hearing, spending time with them, and hearing the stories and hearing the experiences that people have, and I think that sometimes when you listen back to the stories, and this particularly for kids this generation, the difference in older people's childhood growing up, then compared to even my childhood now is very different from my daughter. Who doesn't understand how there could have been a world with no internet. How does that work? But when you hear those stories of people, and back, and I think children are really fascinated by that, and I think I would love to see something with schools as well. I think there could be real potential of bringing in, intergenerational work through schools, that you'd have older people coming in talking about their background and experience and stuff. And I actually think younger people, despite them sometimes getting a bad press, and the ones I have come up, I think they're really interested in hearing about people's lives, because it is for them a different time, and I think that's something that really, it could be a real positive thing going forward and promote it.
Can I just make a quick point about something that you mentioned that I thought was interesting? And it's true that we noticed that the program for government does not focus on sectors as such, but on issues. And I mean, obviously, the Commissioner for Older People is concerned that there's only 2 mentions to older people, but I think that the message that we are trying to bring today is not that this is an issue for a sector, that this is a global thing. When I asked the Department for Communities if they could give me any forecast of spending in Northern Ireland on pensions, they sent me a response that showed that between 2023 to 2029, the increase in pension expenditure here will be from 2.7 billion to 4.2 billion. And my own calculation, you can trust me or not, but my own calculation is that it will be 8 billion in 2040. That's not a sectoral issue. That's something that affects everybody.
Mm-hmm.
So just wanted to make this.
Yeah.
Is that you?
Yeah.
Just 2 very quick questions, and I'm conscious we've got our next panel sitting ready. First of all, you talked about statutory advice. Is that just in terms of your overall remit? Okay.
Yeah.
So we're just okay. And the second one was really around, when I was just having a quick look there at the 9 priorities, you say there's room for a 10th. Just even to finish that line off. But can you not see, even in terms of the removing the barriers under the economy, there's ways in which older people will be catered for, if you know what I mean. If you think about provide more social, affordable and sustainable housing, of course part of that will be for
Yeah, no, I get that, except that there's certain things in there which obviously will impact on older people.
Yes.
But I think the point, what I would say is, because the ageing population is changing society so much, that that has to be considered on its own as a standalone issue. And Angel's point about, older people aren't a sector. They're not a minority group. They're a huge part of our community. So it's not, we don't view ourselves as a sector, and that's that older people go across all those sectors and more. So it's that, whilst I accept the point, of course there's going to be certain things that will benefit, but I think the absence of that focus on the ageing population means that the chances of planning those services, the chances of getting success out of that, I think are really diminished if you don't have that as a priority. And surely it's better to have 10 priorities than 9. Just round it off.
That was a good point to end on. But no, thank you so much to you both. Really, really useful. And as you know, we've got the departmental officials coming in next, so if you can stay, you're very welcome. If not, maybe you might want to watch online later.
Have to head on. But listen, I appreciate your time. Thanks for your time. Thanks for your questions and the opportunity.
Okay. Thanks
a lot.
very much. Thank you. Thank you. Okay, members, take your ease for a little minute while we just change the panel there. Okay, you're welcome. I'll just go through the formalities here before we bring you in. So members, if you go to page 150 of your pack, you'll find the clerk's brief. On page 152 you'll find the draft programme for government, and today we're taking evidence from Michael Kennedy, Director of Programme for Government Unit in the Executive Office, Karen Pearson, Deputy Secretary, and Gavin King, the Consultation Manager, all within the Programme for Government Unit. So you're all very welcome. Obviously we received the draft Programme for Government that we had received previously, and I'm aware that we haven't received papers from yourselves, is that correct?
That's correct.
Okay, but you're going to speak to notes?
Yes, if that's okay.
I'm happy for you to proceed then, thank you.
Thank you. So thanks very much for the chance to come and have a chat with you about the Programme for Government. We just heard the Commissioner note that the consultation closed on Monday, so we're not in a position to give you a firm policy or programme overview. That's going to take a while. The focus from here on in will be a proper analysis of the results of the consultation exercise, which was a significant undertaking, and the engagement in it was remarkable. And we'll give you some headline stats, but Gavin's our consultation guru, and he'll be able to take you through anything you're interested in there. So the consultation started on September the 9th and closed on Monday the 4th of November. And the consultation on the 3 draft impact assessments will carry on, and that will close in about 4 weeks' time. So in that time, the team attended over 60 stakeholder events, and those were attended by more than 1,500 people. They ran a series of events for individual citizens, which were attended by more than 500 people. Obviously, every engagement matters. We've had a blend of people coming to meetings, online surveys and written responses, all of which are equally valuable to us. And we have over 500 written responses. We have over 1,300 survey responses. And in Michael's team on Monday, even on the very last day, the survey results were coming in every few minutes. That was the level of engagement, which was really welcome. And very, very pleasingly, over 900 of the responses came from individual citizens. So we'll get a really good feel for what's in people's minds. So in our initial analysis, we think the top level findings are likely to say that what's in the draft programme, much of that has been affirmed by what we've heard so far. But obviously we will go through the consultation results in detail. We've obviously just heard the Commissioner. If I just jump onto that for a second, we are confident that the results of the consultation will say that there are strong views on anti-poverty, on support to older people. We just heard evidence session there, and support to people with disabilities. We know that's going to come through in the results. So each of the 9 priorities that we began with in the programme for government received broadly positive support, which means where we measure people either strongly agreeing or agreeing with the proposition, and that was a range of about 82 to 95%, and no single priority had more than 10% of respondents disagreeing with it. So the question is, what is there more to do? But what the starting point seems to have had a good response from the consultation. The missions, the longer term missions, also had a good deal of support in the range of 78 to 88%, with no more than 6% of people disagreeing or strongly disagreeing. And peace being framed as a cross-cutting commitment was supported by about 69% of people, with only 6% disagreeing with that. And then finally, about 70% of respondents felt that well-being was a good way to measure progress, and only 7% of respondents disagreed with that. So as I say, we know from what we heard and what we're seeing so far that some themes will come out of the consultation. I've mentioned those. There will be more, of course. The other thing that we heard is that strong support for targets and actions to also be set out so that we can monitor that. And the First and Deputy First Minister have already commented to the Assembly to that effect, that targets will be needed for the final programme. Okay, so there's a great deal of work to fully understand the findings of the consultation exercise, and the Executive will need to properly consider that before reaching any decisions on final version and on policies and programmes. So we're not really in a position to discuss where that might go today, Chair, so apologies for that. But we are committed to supporting the development of the response and the Assembly's consideration in due course, and we'll get into that as we move through. So I think it is just worth mentioning what the starting point was, just for completeness. So the 9 areas in the draft programme for government were growing a globally competitive and sustainable economy, delivering more affordable childcare, cutting health waiting times, ending violence against women and girls, better support for children and young people with special education needs, providing more social, affordable and sustainable housing, safer communities, protecting Lough Neagh and the environment, and the reform and transformation of public services. Those are also sitting alongside proposed infrastructure commitments and actions which will help us deliver infrastructure projects in the future. And these include improving our planning system, investing in water and retrofitting, and making improvements to transport infrastructure. So following on from that, the Executive has included 3 missions and a cross-cutting commitment to peace. So overall, this provides a tool that will help the Executive set priorities for the future, and those will be supported by a wellbeing framework, and we can outline that in more detail. The framework is essentially a suite of indicators which analyse life here and will help the Executive identify areas which demand focus now and in the future. Michael's team has been instrumental in developing that. Other responses to the consultation, once those have been properly considered, the Executive will then have an opportunity to consider the proposed final document, and then that will be brought to the Assembly. So very happy to take questions, and I'm sorry we can't give you more detail today, Chair, but that's where we are 2 days in. But thank you very much.
Okay, no, thank you. I suppose there are quite a lot of figures in that. Will we be able to get your notes after today's meeting?
Yes, by all means.
Okay, thank you. So a few questions to start, and then I'll bring the Deputy Chair in. So just take us back a little bit in terms of how you engaged with the various ministers in their department and actually initially pulling the priorities and programme for government, draft programme for government together. Thank you.
Yeah, sure. I think the starting point was around Easter this year, and it was just a straightforward commission exercise to get information in from departments, and the intention at that point, and I think this was said in the Assembly by our ministers, was to get a draft out in time for the summer. Unfortunately, the election was called then, and there's a bit of delay to our timeline, so we didn't really manage to start that work in earnest with departments until the summer itself. So through the summer we were working with colleagues in different departments and sharing information with them. They're sharing information back, and we basically drafted the document with them. And that was what was presented to the Executive.
Okay. So the peace mission, so you said that there was 69% in agreement, only 6% disagreeing. So how do you see that will, obviously that shows that the majority of people want to see that. How do you see that that's going to be presented within the final version?
Oh, it's in the draft.
Yeah,
but I mean, in terms of actual tangible outputs and outcomes.
Yeah.
Yeah, I think so. We've been, as Karen's noted, we've been consulting quite widely for the past number of weeks, and as part of that, unfortunately, 500 of those responses arrived in the more or less the last 48 hours of consultations. We've not had a chance to read every single response or get to grips with it, but I know that plenty of people do have a strong view on that, and we've consulted with a number of organisations and a number of sessions with multiple organisations at once to discuss it, and that feedback has come back, so that'll be reflected in a consultation report, and it'll be for our ministers and the Executive to decide how best to respond to that in the final draft of the programme.
Okay, and just to pick up on that point around the volume, obviously we are conscious that as a department you have a lot of vacancies across different units, etc. How are you going to process in a meaningful way the number of consultation responses, the feedback from the stakeholder engagement, etc., in a timely manner, because we don't have that much left of this mandate?
I'll start that. So we didn't wait until the consultation closed, so as much as we could do as and when things came in, and we're looking for themes emerging. So Michael's team has been going over those and drawing out some key issues that we'll have to have a more detailed look at. But as Michael says, and we welcome this very much. On Monday, a significant amount of responses arrived with us, and that's fantastic. But that now has to be worked through, and then the totality of that put to ministers. But it is a priority for us.
Yeah, I think it's just it is laborious. It's a lot of reading. Some of these will be organisations sending with their members sending multiple of the same response. So obviously that'll make some of it a bit easier. But again,
has your team been enhanced? Like, have people been seconded in to support you in this process?
So we have drawn on colleagues from across the department. Some of the COVID team helped out for a little while. Gavin has come from a different part of the executive office with his expertise on consultation, and if we can get a little bit more help, that would be welcome. But it is a priority for us.
Okay, and just last one very quickly for me. So whenever the First and Deputy First Minister presented their ministerial statement on the draft programme for government, they said that they look forward to engaging with the outreach sessions, getting involved in the roadshows. And I think there's been 7 in-person events, 7 online events and other forms of engagement. Can you maybe outline what ways that the First Minister and Deputy First Minister have actually got involved in the consultation process of listening?
I can probably speak to that. Yeah, so they attended, do you have a list somewhere? But, basically they attended a number of events. They met the childcare sector, they went to events around housing, business, attended Nikon obviously, and a couple of events with older people, all with the goal of really promoting the consultation and driving the process, the profile of the consultation. I think that's been proven to be very effective in the numbers we've seen in response to those events, and usually when they spoke you'd have seen a corresponding bump from attendees there, so I'm very grateful to them for giving up the time to do it. It's made a big difference.
Well, that's good to hear. Okay, Deputy Chair, please. Thanks.
Thank you. Thanks all for coming in today. I appreciate the consultation. Did just close the start of this week, but obviously we do have quite a lot of questions we're interested in. And I think to carry on from what Paula was asking around consultation, I think you said around 7 in-person events. Could I ask then, how were they advertised? Were they events that were open to the public? Because it might have been just me, but I didn't really see very much about them, or I didn't get any emails advertising them. And if it wasn't just for the public, it was for sector engagement. How did you ensure then that members of the public could feed into the consultation?
Yeah, so I mean, there was a range of ways in which the in-person events were publicised. They were in the papers. There was a social media campaign, and we sent out stakeholder emails to over 20,000 people, and sent that out on 3 different occasions. In addition to the 7 in-person events, we initially had 6 online events scheduled, but due to the iterative nature of the process, once we realised that there was significant demand, then we were able to flexibly increase the number of those. So we increased them from 6 to 8 and then 8 to 10. And I think that was very reflective of the demand, and that we were able to get the word out. And you know, fundamentally, a consultation process is going to be judged by the number of responses. If we look back to some previous PFG consultation processes, 2016 we had 810 responses. This year, over 1,300. You know, so just a huge response, which is fantastic, and really a reflection of the team and just the leadership that was provided by senior management. So yeah, really, we hope that it did have a real cut through, and hopefully you can see that in the results.
Thanks. I think we all look forward to seeing those results, and just from a lot of people, and we just heard from the Commissioner for Older People there, a lot of people do want to see the finalised programme for government have significant change to the draft one that was consulted on. Granted, I know that you can't really speak to that, but just in terms of timescales and how you collate these consultation responses, can you talk through the process of when you'll be taking those to ministers and when you expect we'll have a final programme for government?
Yeah, so we'll be very keen to work as quickly as we can. Basically with this, we know there's a time pressure, especially with the new financial year, although several months away, it's never as far away as it feels. So I think we'll be looking to get hopefully a consultation report finished this side of Christmas at the latest. That's, for the reasons outlined, going to be tough going, but we've got to do it. And after that, hopefully we'll be able to bring a refreshed draft to the executive quite early in the year, in good time to inform business planning.
One more, if you don't mind, Chair. And based on the consultation responses, will you bring recommendations that it should change significantly based on those responses to ministers?
I think the issue we've got with that at the minute is that although we have a pretty good idea of what we have heard at all these events, and huge numbers of people telling us this, until we've been through all of the online responses and written responses as well, which amount to similar numbers, it's very hard to say for sure what the advice will be to ministers, but we will be providing them a full update on what we have seen and heard in the consultation. Will be then for them to take decisions as to how best to make any changes if they're needed.
Okay.
Sinead, please.
I suppose one of the core concerns that I would have in the past, there has been silo mentality in working in government departments. How does this plan change that?
I suppose there's two bits of that. And the first thing it's worth saying is that throughout the consultation events that Gavin ran, we had people from other departments, colleagues, come along and help us run them and convene some of those events, and there wasn't the big laborious task of myth. Everyone was very keen to be supportive, and certainly through the summer, and people probably would rather have been on holidays when we were trying to get information from them. It's my first time developing a programme for government. I was very surprised by the level of participation and engagement. So I'm hoping that for all the institutional changes that could be made, I think the one thing that you can't really buy is the culture and attitude of people, and I'm just hoping that we can maintain that with colleagues by not annoying them too much with some of the asks.
What I'm probably asking you, Michael, is there a mechanism in the programme for government that ensures a silo mentality will not take place in relation to commitments to the priorities?
I think the section to look for that would be in the reform and transformation section, and some of the work going on there. Obviously that's co-led between, at the minute, there's a big role for DOF as well as TEO in that, and I think that's where we'll be looking to make sure that collaboration isn't just a goodwill exercise, and there is sort of institutional support for it as well, but things like the delivery unit, which I think you heard about last week maybe from the head of civil service, will feature in that and will be key to how we keep people on the same page going forward when it comes to delivering the priorities.
So just going through the process again, so you've received the responses and you're pleased with the number of responses that you received. I would probably say the reason that there has been so many responses is that people are fed up in this place, that there hasn't been a programme for government for years, and they see absolute failure in public services. So that motivation is based on the failure to deliver, and that is why you're getting responses from people and individuals that normally probably wouldn't do that. It's more due to dysfunctionality than anything else. But can you outline for me the approval process of that draft programme for government? So once you have analysed and looked at the responses, and you're saying that you're hoping to have that done by Christmas, then does it go back to the executive, and then or is the measurement process going to be put in place as part of the consultation, or the analysis of the responses to the consultation, and then put back to the executive? Or when does the SMART targets be put over the programme for government?
We'll be looking at those with colleagues in other departments as we work, and have been speaking to them about the development of targets ahead of closing consultation. The difficulty with that is obviously that until you've closed consultation and actually got the report to ministers, it's incredibly difficult to say that people are developing targets for the right set of priorities. But I think that work's underway, and I hope we'll be able to provide a view of that to the executive in the not too distant future.
Can I just nip in with a question just supplementary to that? Will there be any role for the statutory committees as well, in terms of, because obviously they had their responses? You're saying you're going to go back to the departments in terms of that, but we'll also be engaging with the various committees? Is that something on no?
At what stage, Chair?
Whenever you've got the responses and you're potentially going to come back with targets, etc., will you re-engage them with the statutory committees like the economy or education, or in terms of setting the targets?
I think that's something we'll work through with ministers as we put in the advice.
Will it just be the ministers, it won't necessarily be the department, the committees?
Yeah.
Okay.
I understand where you're coming from on that. Obviously, in order for the programme to be finalised, it's got to go in front of the Assembly. So I think we've got to work through what happens after that.
Okay, sorry, go ahead, Sinead, sorry.
It's just a base on the targets and the measurements again. So for example, reducing economic inactivity, I'll just take that as an example. Will we be assessing the actual level of the reduction of economic inactivity, and will we be comparing ourselves with other regions in, say, the UK or the Republic of Ireland you know, and where are we getting the baseline from? Is it going to be absolutely now, or are we taking it from the beginning of the mandate? It's just at the minute. I mean, the programme for government was just lots of words, but with no real, and 41% of the commitments made in the programme for government were new. Most of them were already commitments already made that have been late or not delivered in the past. So it's just to find out what is the level of ambition and how are we going to bed them down, and what are we going to assess them against.
Yeah, so I think we're yet to put any advice to ministers on this. It'd be super premature to give you an answer on how we're going to be doing that. I think what we're looking at the minute is how do we go through the process of setting meaningful and smart targets that can actually be delivered upon, and that's the work that's going on with colleagues and departments. And until that's complete, I wouldn't be able to give you an answer. So
right, I'll do childcare then. I'll give you an example of childcare. So we're going to reduce costs for childcare. If that's a priority, a childcare strategy, obviously to put that into a draft programme for government, you have a fair idea of what that strategy is going to look like, how much. So if a parent is lifting that up and saying, oh wow, there's going to be a strategy for childcare, that means by 2027 my childcare costs are going to be reduced by. Is that an ambition, or is that the level of detail that we're going to get in the programme for government, or is it we're just going to have a strategy?
I think at this stage it would be premature for me to say. I think the department responsible for that work will want to consider that carefully before they start to put numbers around it. It's obviously all of these things will have spending implications for me to start making it up essentially, which what I'll be doing now would be quite risky, I think.
I have to say, I'm more concerned than I was before I spoke to you. Okay, thank you.
Okay, thank you. Brian, please.
Thank you, Chair. On the internet, on the PFG website, there's useful wellbeing framework, and you click on those. There's useful indicators. Look back over time. So taking that work forward with 9 priorities, 3 missions, 10 wellbeing measures, and then there's indicators under those. The annual delivery report. What will it report? What will the report be based on? Will it be based on the 9 priorities, or will it be based on the wellbeing indicators? Again, going back to how we measure progress and where progress is being made.
The annual plan will have to deliver against the commitments that are in the programme for government, particularly the actions that flow from it. So, for instance, a childcare strategy and what that's going to deliver. The wellbeing tool is the longer term indicators. So you've got the shorter term actions and the longer term indicators, and it's perfectly possible that a report could be a blend of both. Is that right?
Yeah, I think so. And it's right, like the wellbeing and data set that it replaces what had been the outcomes framework. We've taken most of that directly and lifted and shifted it into a slightly different format, and hopefully what that does is not just provide the executive with the tool to actually see life in the round here, but also actually provides the likes of yourselves and the public with a tool to do exactly the same thing. I understand that, but essentially the more we can build that type of data in, the better the decision making you would hope would be as a result.
Yeah. And I expect that will be just an ongoing live that you'll be constantly updating as data becomes available. But the report will primarily focus on the 9 priorities as it currently is. Is that fair to say, showing that where there's progress has been made on each?
Yes, that's how I would envisage it. So that you've got a finalised report with a set number of priorities, actions flowing from those to be reported on, and then the framework, wellbeing framework there to help us see the longer term direction of travel.
Okay, thank you, Chair.
Was that you? Okay. Carol, please. Carol?
Thank you, Chair. The question I want to ask is in relation to equality impact assessments. Will there be a full equality impact assessment into the programme for government?
Yeah, that'll be the intention. We'd like to update all of the impact assessments once consultation closes in those.
So they're the ones that are still out to consultation at the moment, so we've got another 4 weeks to run on those.
So it's just the 9 categories that were consulted on that are...
We've got an equality impact assessment out there, and as well as that, there's a rural needs impact assessment and a children's impact assessment are all out there, and they'll all close at the same time.
Okay, so so it's equality plus children plus rural needs?
Yeah.
Or is it just rural needs and children?
They're two separate reports. So rural needs, children, and also an equality impact assessment are all out for consultation now.
Okay, so the full equality impact assessment will be based on Section 75?
Yeah, that's right.
Okay, and when do you anticipate that being concluded?
We'd be looking to do that just as we went out to consult the first time around with the full suite on the same day. We'd be looking to put those out at the same time as the final day after.
So effectively then the result of the quality impact assessment will be brought in at the same time as the findings of the consultation will be presented to the ministers?
I would think so, yeah.
Do you think so, or is that the way it's going to be?
I think that would have to be the case, yes.
Okay. Thank you, Chair.
Okay, thank you. Timothy, please.
Thank you very much, Chair. The draft programme for government was very colourful, plenty of nice pictures in it, glossy document, but there was nothing in it to tie a minister to actual outcomes, and that's something that concerns myself. And from what I've heard today, I'm not entirely sure that that'll be changed once we get to the end of this consultation process and the final document is presented to yourselves. I want to pick up first of all on the childcare strategy. So on page 24 of the programme for government, the following is said: the executive will develop an early learning and childcare strategy which improves provision and includes 2 high-profile targets, supporting the development of our children to give every child the best start in life while supporting more affordable childcare. Sounds great. So it does. Nothing against what it says, but like Sinead, how is that measured going forward? When I pressed the Finance Minister on the Barnett Consequential for GB, London sends us 57.2 million for childcare. At the minute, we spend 25 million in childcare, which means 32 million of the money that comes from London for childcare is spent on other things. Nobody's ever been able to say where that money has gone. Do you envisage that as a result of this draft, the final document will have a commitment of how much will be spent in childcare? Will we be seeing that the Minister will have greater powers to be able to pull in more funding, the funding that has been allocated from London to actually spend in childcare? Or will we continue that there'll be no targets to meet and that families in Northern Ireland will continue to be shortchanged when it comes to childcare?
On the targets, those are being developed and they will be brought to the executive when we have a suite of targets to bring to them, but it'd be beyond me right now to say what those will be. On the exact amount of money that will be allocated in the future and its relationship to the Barnett, I think that's a matter for the Department of Finance. Ultimately, the programme for government will help the Department for Finance and departments work out how best to prioritise where they put their efforts, and you'd expect to see things correspond to that, but I don't know exactly what the number would be once it's spent.
Yeah, page 78 then, we'll move on, talks about Intertrade UK. Pressed the Minister on this previously and I was told that there is no money being provided by Stormont for Intertrade UK. Is that changing? Will that change? Is there anything in the programme for government for a commitment to provide money for Intertrade UK?
There's nothing in the programme for government about providing money for Intertrade UK, and I'm not sure if that is whose responsibility that is. I've always worked on the assumption that it was a UKG responsibility, so I'm afraid I don't know the answer to that.
So just to put it in context, so the same page talks about Intertrade Ireland, and since the protocol came into play, the budget for Intertrade Ireland has grown by 1.8 million. So surely the executive will look, and this programme for government will look to try and address that Intertrade Ireland is receiving funds, £1.8 million more, and we're told that Intertrade UK is receiving no funds from Stormont. I certainly feel that's a failing, and I hope come the end of this process that we'll see something included in there of a commitment to fund Intertrade UK to give it some meat in the bones and show that we're serious about strengthening our commitments east-west.
Just to clear up, saying I don't know the answer to whether or not Intertrade UK receives funding from Stormont rather than that it doesn't, which I can only apologise for. Look, I know there's a bit of it might sound like a trite answer, but the ultimate thing we now have to do is go through the 1,500 or 1,400 consultation responses and get a sense of where people are coming from and what they would like to see reflected to ministers, and we'll be doing our best to reflect it as accurately as possible, and it'll be for ministers to take those decisions once they receive the report.
When officials were here...
Sorry, just before we move on. Sorry, Timothy, can I just come in on something? Because it's where you're going with this. There just doesn't seem to be any clear targets. There's unclear relationships between the budgets and the programme for government, and no matter what the consultations say and who is saying it in the consultations, there has to be something that links the both budgets and programme and priorities, and just they're not there. It's completely inconsistent. It's inconsistent where the funding is being spent today, now, and projected. So I don't know where we're going in December or before the next, end of year budget, because there's nothing tying the two together. Sorry, Timothy, for speaking over you.
And just building on that, I'm not getting any warm, fuzzy feeling from yourself today that that'll change in the near future, and what we'll get is another lovely document with plenty of colourful pictures and no real substance. Moving on to the next one, violence against women and girls. And the last time the officials were here from the Executive Office, I asked to define what a woman was. Has anything changed within the Executive Office since that to discover if they've agreed on a definition of what a woman is? Because it's very, very important when it comes to one of your flagship strategies is ending violence against women and girls.
I think, if I may cover that, I think my colleague said there wouldn't be a definition because they weren't going to define something that has an understandable meaning. Nothing's changed around that. On the funding, may have come back to Chair. I think the budget process is really, really important that it sits alongside the programme for government. We wouldn't have expected to go out in a draft consultation with a fully costed set of actions. This is high level priorities which will lead to a finalised programme for government with actions agreed, but that has got to move forward in tandem with the budget process. But I don't think we could cost at this high level. The costings will have to be done in line with the actions that flow from the process that Michael's outlined, that he's engaged in at the moment, looking for the right actions and targets to propose to ministers, and then financial decisions will be made by the executive in the normal way.
Just to pick up on the violence against women and girls again, the last time I was told the issue was the violence rather than defining what a woman is, and it appears that seems to be still the same position. On the back of that evidence session, I was contacted by a number of people, and they were asking me, what about women who fear violence from biological men gaining access to female-only spaces? Is that something that has been reflected? Or is that just still, we say things in this committee and they're not taken away?
I can't speak for my colleagues working on ending violence against women and girls. They were here and they gave their evidence, and they will have heard your concerns about that on the day. In terms of will that issue come out of the consultation exercise that we've got on programme for government, I'd be really surprised if it didn't in some way. Someone will express a view on that, and that will be taken into account. We were talking in the team about how we make sure that what we hear on the programme for government consultation is fed back to people that have got to lead the work on the strategies. So, for instance, childcare and EVOG. So it won't be something that's done entirely in isolation. We'll be talking to our colleagues about what we've heard in the consultation.
Yeah, on the same issue, when I mentioned that there was a number of stakeholders had been engaged in that list, the officials couldn't name a single critic of modern gender theory engaged when they were looking feedback on the end of violence of women against girls. Will that be reflected?
You're taking me out of my work area, I'm afraid, Mr. Gaston. It's not something I'm close to.
It is important down here that this is the Executive Office Committee, that issues that members raise, do form part of the outcome. Otherwise, there's little point of us coming and scrutinising and asking questions of witnesses. Bringing me on to the last one then, that it appears to remain the position of the Executive Office that casement is a flagship project. Can you confirm, is that the position, is that the agreed position of the entire Executive?
I couldn't comment on that. That's, again, not something I'm working on or close to, and nor my team. It's not something that would come across our desks, I'm afraid.
So, I suppose just to finish off on that, when it comes to signing off, there obviously First Minister and Deputy First Minister have to agree. So when that comes before us, First Minister agree, Deputy First Minister and the Executive Office would agree if that is to remain the flagship project of the Executive Office. Is that your understanding of how the Executive Office works and functions?
Well, casement is currently a matter for the Department for Communities, as I understand it. But the role of how that might come to the Executive in future, that would be a process to be gone through to be getting it onto an agenda and to reach an agreed position, but it's not something we're involved in.
You finished, Chair?
Okay, thank you. Claire, please, online.
Thank you, Chair, and thank you for coming to present to us. I suppose a lot of people would have felt very sceptical about this consultation process, particularly given that we're in a reduced mandate and time is of the essence to kind of move forward on being able to achieve something by the end of it. So I suppose how can we reassure people that the First Ministers and the wider Executive are listening and in fact further than that are hearing what comes from this consultation outcome? And I suppose what does that look like? If every consultation response said that we need to include our ageing population, for example, within the final programme for government, will that happen, or is it a matter for the ministers to take that forward? So I suppose really to what end is the purpose of this consultation? And I suppose even to kind of labour the point that both Sinead and Timothy have talked of, it does feel like it is a done deal in terms of what has been suggested and recommended, because we're pressing ahead with the budget without actually knowing what our final programme for government is going to look like. And Karen, I do take your point that this is very high level, but equally if we are bringing into the conversation an ageing population, for example, then it's that high level conversations that will feed down into that we need to be thinking about whenever we decide if we're going to support the budget in the coming months. So I suppose how do we reassure people that it will be listened to, that it will be assessed, and the evidence that the consultation process in itself will be used to give a genuine final draft that has been considered of various stakeholders' opinions?
It's a really good question. I think that the answer to that, Claire, is that we will, as officials, we will be giving fulsome advice of the sort that you'll have seen in the past to ministers, to say this is what we've seen in this consultation exercise. It's then a political judgment call, but it will be our job of work to make sure that they've got the full picture from the consultation. And I want to just go back on something you said, Sinead, about the people's being disenchanted. We also set out to make sure that the consultation was as easy to get involved with as possible, and that was by design, because we wanted people to come forward. So Gavin put a huge amount of effort, as did the rest of Michael's team, into making sure that the online survey, the ability to attend the events, and that's because we genuinely want to hear what people have got to say, and so do ministers. So we will be putting very detailed advice to them on this is what we've seen and this is what we've heard. We can give advice to an extent on whether they go further than they've got in this document, but ultimately it will be ministers and the executive will be taking their decisions. So, but I do want to assure you that we've not gone into this in order just to get 1,300 responses that we're going to do nothing with. That would be unfair to everyone. So that's our commitment. We will be doing this properly.
Yeah, no, I appreciate that, and I think there would be serious questions raised if those 1,300 responses were ignored, i.e. we end up with something very similar to what we went in with. So I suppose in relation to after you collate and analyse the information into a report of factual opinions, I suppose, do you then put forward recommendations to the ministers so then they can make that political choice? Is that typically how this works?
We could recommend that they consider certain things. Whether we go as far as to recommend a particular change to the document, we just going to have to work through that. But we're not going to wait until we've got to the end of the analysis process. We will be talking to ministers and to special advisors from here on in. This process will just evolve so that we're constantly giving them a feel for what we're seeing. That having attended, and I agree with Michael, the fact that our ministers went out to some of these events was fantastic, and we were very grateful. They'll have heard some of this themselves. They'll not be surprised that there are strong views, and we just need to shape it for them in a way that they can make their political choices around it.
Okay, thank you. Thank you, Chair.
Okay, thank you. And Harry, please.
Okay, thank you, Chair. I'm just thinking in general on the consultation, were you satisfied with responses both in content and amount that did come back?
Yeah, just to say briefly on that, as I've referred to in a previous question, in terms of getting over 1,300 responses and compared to 810 in the nearest comparable programme for government consultation process, so that's a fantastic number. I think in the number of events that we were able to hold, again, in previous consultations, the high figure was 33. We had over 70, so it was fantastic. I felt, Karen has referred to, people took their opportunity to really give us a clear, response. And just again, compared to previous consultations, with a very high percentage of responses from individuals. So hopefully I think the consultation process really played a part in that. And one of the points I felt that the Commissioner for Older People made when he was talking to you was, people are all different. So it's so important to get that difference, and to get as many different people as possible coming back to us. And I feel we've got that. And as Karen alludes to, that does bring us challenges, in terms of analysis. But that's what we're going to move on to next.
Very good. Okay, thank you, Chair.
Thank you. Just to pick up on a point you made there, Karen, around the fact that so many people took so much time to respond, and we've seen some of them in this committee and our packs already. When we were consulting on the potential for a Bill of Rights, there was very similar. A lot of people put a lot of time and effort in, and I was always very conscious that people were highlighting like legislative policy changes, etc. And I hope, take at face value, that what you will do with the information you've received, that you will then be able to distill that down into the departments so that they can pick up, because we all aren't totally across all our briefs. So, I think the departments will probably pick up some new stuff that they should really be focusing on. So that's just a comment. But the question is, how are we going to be able to engage with yous going forward then as this process evolves? Well, in terms of coming back, in terms of providing us with updated papers and stuff, what would that look like?
We'd be very happy to obviously reflect that back to our ministers and to talk to the clerk and see what's the best point in time to do that. But yes, we totally understand your interest, and we'll reflect that back.
Okay, thank you. Do you want to come in quickly?
It's on the 1,300 responses that you've received. So the Commissioner for Older People was here, very, very passionate, gave a great detailed brief, laid bare what he thought should be considered, and I would have no doubt that would be communicated in the response. So if the programme for government comes forward without any of that or without any changes, where can members or where can the public examine what the consultation responses or a flavour of them has been? Because obviously, if he's talking about potentially a 10th priority, and that isn't just, you know, it's shot down, it's not brought forward, but there's a strong evidence based on a strong consultation response that there should be something in for the ageing population. How can members of the public, how can members of this House, you know, feel and have a sample of what the feedback has been to give us an assurance that, hold on a minute, these consultation responses have been considered, have been acted upon, and reflect what members of the public have fed back?
I mean, the consultation report will be a published document, typically alongside the consultation report, where people have given permission for their responses to be published, and that's obviously for the person responding, not for me to decide. We'll publish those alongside the consultation report, so it should be as transparent as we can make it.
Will that be broke down by minister, or will that be just a one-size-fits-all document?
It wouldn't be broken down by minister. It's for the executive to use in reaching decisions about how the programme is brought forward and developed and finalised.
Yeah.
Thank you. Thank you very much. So a long session there, but I think it's really important because it cuts to the heart of what we are doing here as a committee. So appreciate your time. Would appreciate your notes so that we can reflect on those, and any other updates going forward in a timely fashion would be very much appreciated. So thank you, and thank you for your work on this. Thank you.
Thank you.
Okay, members, I'm going to take a break here, just a comfort break. We've been sitting for quite a while, 5 minutes. But what was you suggested as a potential action then?
Chair, one of the things the committee may want to consider is that in all policy areas where policy is being developed, the committee has a role. The committee may wish to consult, but the committee has a more important role in that, in advising the minister on issues like that. And usually what happens is that committees would receive a summary of consultation responses, which it seems in this case would be coming along with the report. So I mean, every committee and department is involved in this. So the committee may want to consider asking for time following the consultation report for the committee to consider the summary of responses and to respond to their departments before the final draft goes to the minister.
Okay, should we write then? Is that
if that's what the committee would like to do.
Absolutely.
okay? Can we take that down? Were you going to say something, Connie?
No, just that's a good idea.
Okay. Okay. All right, members. We'll take 5 minutes then, just a wee comfort break, and then we'll come back with plenty more to get on with. Thank you.
Committee Room 30. Sound. 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 Committee Room 30, 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 sound. Committee Room 30. Sound.
I'm having to pay him.
Okay, members, we're back in open.
No, I know.
We're back in open session. Thank you for your patience, especially those online. So our next item on the agenda is the October monitoring and departmental written briefing. So I think we received that yesterday at 1:13 or something. Was it something very late in the day? But I'm saying, I think even in terms of the actual document coming in, so less than 24 hours.
13:14 yesterday it arrived.
Yeah. So you've got your clerk's briefs on page 241 of the pack, and then there's an updated brief on page 12 of the tabled papers, and then there's the departmental papers from pages 14 to 28. So obviously, sorry, I'll come in.
I don't know if you discussed this earlier on before the meeting, but we're constantly getting late papers to this committee.
Yep.
It's really difficult. It's really difficult to do any type of scrutiny.
Yes.
If it happens once or happens twice, you can forgive. It's happening every single week. You know, I think it's disrespectful, and they need to send us papers in a proper way. I mean, once we start our week here on a Monday, we haven't time to read all the papers. If we don't have them on a Friday,
I know.
do you start them over the weekend or whatever, so you can get your teeth into them?
Yes.
You know, the week's gone. You know.
I know. I totally agree.
I'm in here and early in the mornings. I can't do it in the mornings. I can't do it in the evenings because I'm getting down late.
Yeah.
I need the papers over the weekend.
I totally agree. Go ahead, Carol. Thank you.
Sure. I was going to raise the same thing. I have my hand up. I mean, I raised this with Michelle when she was in. I mean, the October monitoring round and whatever comes out of the budget and everything else, it's just too important.
Yes.
And regardless what support people get or not, I mean, the likes of Sinead, Nats and Derry, they're up and down the road at all hours. I just think it's not acceptable.
No.
And to expect us to go through it in this fashion, I just don't think it's not sustainable.
No, I totally agree. I suppose just to pick up on what the clerks put in the briefing there around the Function of Government Miscellaneous Provisions Act indicates that we should have gotten it 7 days after the date of the department's submission for each monitoring round. So I think we should have received it, I think it was on the 23rd of October or somewhere around that, wasn't it?
I think so.
Go ahead.
Chair, maybe would have possibly been the by last Friday, I think.
Okay, but we definitely should have.
1st of November.
I think was the deadline for the department the 23rd.
Oh, so it was 7 days after that, but still we should have got it because they would have had them produced by then.
Yeah, and Chair, there's also the consideration of the agreement for interaction between committees and departments, which says that everything should be with the committee 5 working days before.
Which is the fundamental point.
Yeah, so with last week having been recess, that 5 working days would be 2 p.m. on the Wednesday before that, which would have been the 23rd.
Okay. Yeah. I suppose when I had a quick look at the monitoring forms, that one of the bits that jumped out at me was the reduced requirement in relation to the permanent HIA memorial, and it stated there that there's agreement on these have not been reached at the stage where work can be progressed in 2024-25. And as we see in the committee pack in terms of correspondence, we know that the victims and survivors of historical and institutional abuse are very dismayed that they haven't progressed with the memorials and stuff. So I think that it would be my proposal that we invite the departmental officials to come next week to explain why we didn't get the papers on time, but to talk to them because there are some fundamental parts in it that I would like to get some explanations on. Go ahead, Timothy.
If the officials are coming next week, could we look back over the last 8-10 weeks cycle of a time that the papers have arrived to show that this isn't a one-off? There was 1 week there was tabled papers arrived when we were in the committee.
Right.
And I agree with Sinead, it is disrespectful to the members. Nobody can perform a scrutiny role if they haven't the time to read over them, digest them.
Well, today was a prime example with the TO officials on the programme for government. Sorry, did you have a suggestion? Did you suggest?
Well, just that
Oh, yeah,
if the officials are coming,
we've
that
taken
we
that
get
one, yeah.
a
Okay.
record of a number of months to show when they come and state very, very clearly that it's not acceptable by this committee.
Okay, I think even if we go back to February, because there haven't actually been that many times when it's been just pure TO officials. Some weeks it's been, outside bodies or commissioners and stuff. So I think would that be reasonable?
Yes, Chair. So just to confirm.
Sorry, that can be done both in relation to the timeliness of papers coming to the committee and also in relation to the deadline for responses coming back to the committee. So if the committee requests information, it expects a response back within 10 working days. So both those things can be considered. And it is possible then to keep an ongoing record and a track of how the department is responding on an ongoing basis.
Okay, thank you. Carol, did you want back in?
Sorry, Paula, I was actually going to suggest same thing Timothy has. I think we just need to dig out the outside bodies with less control over.
Yes.
Individual witnesses with less control over, but certainly departmental papers. I think if we just take a sweep back from February and break down when the papers came, and then just work it back from there. And in preparation for the officials coming next week, if they're going to present anything additional to what we've already received, we need to have that in advance as well.
Yes, so no, that's a good point. Is there anything in particular anyone else spotted in the papers that they want, to really highlight next week?
Yeah, sure. There's a load of stuff there, to be frank. I mean, even the things around the FTC, there's not a lot in that. Is that just for social or for co-ownership? I don't know. There's also issues around non-earmarked budgets. There's stuff around SIB. And if you remember, I asked the officials who appeared in front of the committee regarding the violence against women and girls around what money has been spent on SIB developing that strategy and their involvement. We're still waiting on that. So there's quite a lot there.
Yes.
Communities and transition, and even things around, as you said, the HIA and the memorialisation, and then what additional work can be done around particularly urban villages and that. So there's quite a lot there.
Yeah, okay.
To be honest, there are issues that the officials need to bring information on.
I agree, and I just want to actually add one, and I'm sure Connie will agree with me. I think that given the events in recent weeks with the murders of the women, with the attacks in Derry on women, etc., you would have thought that they would have put forward a monitoring bid in terms of getting more money for delivery of the strategy. So that's something I would like to get a wee bit more thought on. Any other comments or suggestions, or no? Okay, well, you can work on that then to try and get them here next week. Okay, members, moving on then. So we're moving into the inquiry into gaps in equality legislation update. So in the pack you will see that the clerk has provided the groups that have been invited, and
Sorry, haven't been invited yet. It's just the agreement.
Have they not been invited?
Not yet.
Oh, right, okay.
It's the agreement with the committee first.
Okay, so our members' content. So on page 244, I thought we'd asked for them to be invited. No? No, okay. Well, after today then. Is there any other groups? I think we've put the call out before in a previous meeting, but is everyone content with that list? And if there's anybody they think is missing?
Sure, we did ask for those groups to be invited. That was my understanding.
I thought that yes, we'd asked for the invites to go out. No.
Yeah, that's my understanding.
Yes. Okay. Sorry, just one at a time. Timothy, go ahead. Sinead, and then Harry.
The Women's Rights Network.
It's on there. It's on there. Page 245 under the sex section, Women's Rights Network. Can't speak today.
All right, that's grand.
Okay, Sinead?
I'm just wondering, is there enough regional balance in some of these groups as well? Because some of them are Northern Ireland wide, but not particularly from the regions, and sometimes they're not reflective. I've said this before. I'm looking at some of the women's groups there, because I really do think the voice of small local women's groups is really, really effective. You know, the wider kind of Northern Ireland, they're brilliant, like the Regional Women's Consortium and all of that there, but sometimes it's good to hear local communities that are working in the same area.
Okay, Claire, go ahead.
Nothing in relation to age.
Had a session on.
Okay. The assistant clerks just said that it's because we've had up the panel. Do you remember we had actually a substantive? But do you feel that we should also have maybe one that allows sort of more grassroots organisations that work with older people? Do you think that might be?
Potentially, but it's by having an event that, you know, misses them out, makes it seem like they're not being invited, and it's not being considered. So I appreciate that we've had them as a committee, but it's an event in itself. So I think it would.
Yeah, I think there's time. 4 weeks. I think there's time to get them invited.
Yeah.
Chair, if I might suggest, if the assistant clerk looks at the relevant age-related groups, would members be content to consider that through correspondence and agree, so that it can be done as quickly as possible?
I think all the invites would need to go out as quickly as possible. So, and I think there will still be time in the next week or so to add to it. But if we can get the initial round of invitations out, that'd be great. Thank you. Okay, so just a reminder of the date, etc. So in terms of the forward work programme, there's the clerk's brief in terms of HIA institutional abuse, and you've provided there with some information in terms of responses from the likes of Bernardo's, de La Salle, etc. So some we're still awaiting, some have responded to our invitation to attend, some not committed, some are unavailable. I would propose that we've got our session in 2 weeks' time with Paul Sweeney, who was the facilitator, independent facilitator appointed by the Executive Office to engage with the religious orders and other institutions who were involved in the historical institutional abuse in relation to their contributions. So I'm going to propose that we pause this until we've had the session with Mr. Sweeney. How do people feel about that?
It's okay.
Is that okay? So it's only 2 weeks. I think we'll be able to gather more information from what barriers or any issues he's faced in terms of actually engaging and getting the payments. Is that okay? Are we in agreement with that? Okay, thank you. Okay.
Apologies, Chair, I'm going to have to leave soon. I have another meeting this evening.
No problem, thank you. Okay, so moving on then to the forward work programme itself. So we will obviously add next week if we get the departmental officials in for the monitoring round, but we've got the Independent Monitoring Authority for Citizens' Rights Agreements, EU Affairs Manager, and say that will be added on.
It's just the victims groups as well.
Oh, okay, so the victim. Oh, so the 20th, then we've got the historical institutional abuse, and then 27th, then we've got the victims and survivors, CIJ and Amnesty, and then there's a list of list of potential attendees for this session, and they are WAVE, the Pat Finucane Centre, South East Fermanagh Foundation, Relatives for Justice, Ulster Human Rights Watch, and I'm just wondering if people are content with this list of potential attendees, or if they wish to suggest any alternatives. So that was 5 there. Are people content? Because with 5 seats. Go ahead.
No, it's just looking at the I had raised the faith-based groups or church groups, so there's a fairly wide band
yes,
there.
yes.
Chair, just to say thank you for
that's good. It's good.
including that.
Sorry, there's no Hindu church there in that list.
It's just the gaps in terms of the invite, and yeah, okay.
The faith. We have the Belfast Islamic Centre, but there is a Hindu temple. And there's quite a few.
That's fine. Yeah.
Members of that.
Yeah, and I was talking to a lady who is involved with the Jehovah's Witness in South Belfast. So I wonder if I could just take them on too. She was very friendly. I was like,
yeah, of course.
In the Holy Land, just had a lovely chat with her. Okay, so that's where we're at there. So are members content with the rest of the forward work programme? Yeah, okay. Okay, so correspondence. You'll find this, members, on page 260 of your pack and page 27 of the table papers, including the summary of committee correspondence. So just want to draw your attention to page 262 of the pack, and this relates to contact or have any plans to meet with the independent assessor regarding the review of COSICA, the commissioner. So I'm just wondering, are people content for me to go ahead and engage around that? I suppose we've had the commissioner in front of us, and we're very concerned about some of the issues around the ending of the redress scheme and the potential for the support and for her post to go. Are people content with that?
Mm-hmm.
Okay.
Yeah. I mean, we've also been contacted through the party. I don't know if all other MLAs have been, so they have contacted members individually.
Okay, good to hear. Okay, so members, on page 387 of the pack, you'll find the letter from Rosetta Trust regarding the proposed action outlined during the TO committee meeting on April the 10th of this year. So, as we know, Jerry and others have been engaged on the panel, and then I think a lot of us have met with them or certainly corresponded via email that they're very concerned at the delays in terms of, for example, the memorial and other forms of support. So I'm just wondering, are you content for me as chair to write to the department to seek an update on these actions and specifically what resources are being allocated to ensure that they're expedited? People okay with that?
Yeah.
Okay.
Apologies, Chair.
Okay, thank you. Refer members. I don't think I need to do that one, do you?
Would sure you, if whatever you think it's
okay.
I can put it into a briefing paper for next week's meeting.
That's okay. Okay, members, is there any other correspondence they wish to raise? No. Okay. Any other business? Go ahead, Timothy.
Yes, Chair, thank you very much for bringing me back to, I suppose, where we started. And it's back to the minute. So there was the meeting that was requested by the First Minister that you had, that we didn't have anybody taking a minute at it. We're now relying on a witness providing the minute, and 2 weeks after that meeting has taken place, we still don't have that minute. That certainly concerns me.
It concerns me too, because we requested it at the time. So
It didn't concern you at the time to take your own minute, Chair?
well, I was having the meeting. It would be up to others. How can I engage them? Anyway, keep going. That's fine. Keep going.
On the 25th of October, an Assembly spokesman told the newsletter, I'm quoting here, the committee has not yet received the minutes of the informal meeting held on Wednesday of this week, but has submitted a request for them to the Executive Office.
Yes.
What role does the committee have in that, or is it a case of, because you're the chair, is that a decision you take with the vice chair, or is that a decision you take on your own to, represent the committee and put in such requests? I'm trying to understand here the role of the committee and the role of the chair in this, because it brings me on to some other points. So at no point should the committee have been asked if that was the agreement of the committee, or you to get approval?
No, I don't think we need to get the approval. There would have been an expectation that we would have received them, and whenever there was public interest in it, then that's whenever the officials then requested those. Are you trying to say that we shouldn't have requested them now?
No, I'm a member of the committee, and I feel that there has been a number of decisions taken over the last couple of weeks, namely the private meeting with a witness and requesting the minutes that the committee has no knowledge of, essentially, that this is decisions you have taken yourself.
No, I haven't taken them myself. I've taken them under the advice and in partnership with the officials here at the Assembly. Haven't acted unilaterally on any matter, and it's always been with advice and in line with procedure. Go ahead.
Chair, was it a fairly brief meeting?
Yes.
Well,
could officials under this committee not produce a minute from it if it was quite a brief meeting?
You can't produce something 2 weeks after.
No, but can a minute of the meeting not be produced?
Well, the way it is transpired is that the First Minister, under the Ministerial Code, is required to record meetings, right? So she isn't necessarily required to provide them to us as a committee, but we have asked them so that we can furnish them to all the committee members, okay? So there possibly is a broader question around whether whenever a committee chair is accompanied by a member of the committee team, as in staff, that they should take that. But that's not in procedures, it's not in standing orders at the minute, and it might be something that individual members might want to take to the Committee for Procedures or the Committee for Assembly and Executive Review. So that's something that other people can raise if they feel that this, in this instance or similar instance, that this should happen.
Yeah, but just to make that
sorry,
point.
go ahead.
I mean,
Go ahead, finish now.
Well, just to finish it, I mean, I do think it just makes the point about the committee is an instrument of the Assembly. You know, it's separate to the department and to the minister, and it needs to have its stand on its own feet. You know, so I think it should, even if there's, if that means there's 2 sets of minutes produced, I think that's appropriate, because the committee has its own standing, you know, and should have its own record.
That's a fair point. That's a fair point. Go ahead, Carol.
It's not on this issue, Paula, so if you want to wait
Yeah.
until this is finished.
Okay, go ahead.
Yep. So going back to that, my understanding is in the fallout of RHI that the only legislation that came out of that is one following Jim Allister. So on that basis, yes, there's an onus on the minister to take a minute. There's also an onus on yourself to take a minute. It doesn't resolve you of your statutory duty if they record a minute of that meeting that took place. And that's something that seriously concerns me.
And I've just addressed that. If it concerns you, then maybe it's something that you should seek to engage with the Procedures Committee around a change in standing orders.
And 2 weeks ago, prior to the meeting commencing, the committee meeting, I did say that I felt with you going to that meeting it compromised your position to chair that meeting, because it was with somebody of a political nature, a witness of a political nature. I would like to put forward a proposal today that if such instances arise in the future, that you would seek permission from the committee to do that, because there's obviously been a lot of kickback. It's damaged public perception of the committee, it's damaged public perception of Stormont, of how that has happened.
Well, I would push back quite a bit, Timothy, because it's you that has been creating a lot of the false narrative around this. And trying to, well, the fact that you didn't turn up to that meeting in Derry, you then tried to insinuate that it wasn't recorded when it was recorded. You then said that we had to submit questions. The clerk sent out an email to say that that wasn't necessarily the case. You didn't go and correct the public record on that, so you just left it hanging. That so there's been that. There's been your misogyny to me at the last meeting that was called out. There has been the appalling treatment to Kelly Turtle that you still have not apologised for. There's been abuse of others. So the fact that you are creating this narrative out there in the public domain around your treatment, we as a committee were working very collegiately. Now, we are of all different political viewpoints on things, but at the end of the day, it is our role to work together as a committee to hold the First Minister and Deputy First Minister, their departmental officials, arm's length bodies to account. You're not here to hold me to account. There are other avenues that if you have a problem with how I've chaired this meeting, you can explore.
Is that the way you would rather I went? Instead of having these out in committee, you would rather
I have no
go out
problem,
in
but
commission?
I think that you're just trying to drag this out just for grandstanding and for your own
It's not,
and for
I
your
think
own
it's for
form
you to
of
try
political
and,
point scoring.
No,
And
I would disagree, and I push back strongly as well, because I feel that you've tried to sweep this issue under the carpet.
But there's nothing to sweep under the carpet. I have been transparent with all of this. I have not held any information back.
Where's the email trail? So we've got...
Well, that was not my doing, and I have asked the assistant clerk why that was in terms of date. I had nothing to do. I have no role in terms of what goes out in the committee packs.
Well,
no role at all.
You will
the clerk
remember
does not,
2 weeks ago
the
that
clerk
I did
does
ask
not
for the
work to
timestamp.
me. The clerk does not work to me. I do not see the information for it sent out. He worked to this committee. So the fact that it went out without a date stamp has nothing to do with me.
Well, as chair of this committee, will you ensure that the information has been requested?
I asked the clerk at the meeting 2 weeks ago to ensure that happened, and I don't know why that hasn't happened. He's not here today. He has not been in work for a number of days. I have not had an opportunity since the committee pack came out to ask him why that was the case.
Well, will you ensure that for next week's papers, once again reiterate
yes. If
that
he's
that's in
back
it?
and
All
find
the
out.
correspondence that has taken place between yourself, the Dallo, yourself
I
and
never
Clerk?
engage with the Dallo. I never engage with the First Minister. I never engage with anybody. I engage with the clerk who does all the work.
Well, it's important to have this information put out, transparent in the public domain, and I hope you as chair will ensure that that's done. I still would make the point that I would like a proposal put to the meeting that if there is somebody of political nature that's a witness to this committee, requests a meeting of such nature that this committee is informed prior to you agreeing to go on.
Well, I explained last week why the timing was very difficult and why that was the only opportunity to get it out. I feel that I've answered this enough. There is nothing, I haven't done anything outside my roles and responsibilities as the chair of this committee. And if people had have, and to pick up on Brian's point, Brian, I appreciate that you think that there's maybe some questions that weren't answered, but I crafted my questions in such a way that they related to the work of this committee so I could ask them. So, and then whenever Harry's questions weren't in relation to it, I said, could you please couch it in relation to the Executive Office Committee? You've had days with that legal advice to think about how the questions should be crafted.
I did craft mine
you
all
didn't.
around
Yours
the
were for
ministerial code.
Yours were for the Assembly Commission. And then you did get the answers back.
Mine were for, they had the First Minister here in front of us. It was all about a
The
confidence
Standards
piece.
Commissioner is about the ministerial code. Go ahead.
There has been a proposal.
Okay, there has been a proposal.
So,
Okay.
Chair, but however, may I caveat that proposal? There will be certain times, for example, if there's a ministerial statement, that there won't be time. Sometimes ministerial statements can be at short notice. The Minister will seek to meet the committee chair or vice versa. So there won't always be time to seek agreement from the committee
Thank you, Harry.
to meet with the Minister
There'll
in
not
those
be
areas.
there'll not be a witness at that stage. Whereas this is all about a witness coming to the committee.
Well,
So the proposal is solely in relation to witnesses coming to the committee.
but I think what you haven't allowed the context for this in terms of all the stuff that you've been briefed from the media is that this was a very particular set of circumstances. This would have been the only time that I would have had to go and have a meeting at her request, not my request, and not my didn't initiate any of it, was because of the unique nature of the blurring of lines, to use the First Minister's terms, around her roles and responsibilities as the Northern leader, and we had our own legal advice in that regard. So very short, perfunctory meeting, and for people to try and insinuate that in any way, and I think that the fact that she asked for the legal advice would show that I didn't give it to her, didn't speak to it, and also the fact that her first question she was taken aback by it would show that I had not in any way shown that I was going to be lenient. So.
And then you let her chair the meeting after that.
No, I didn't let her chair the meeting after that. I think there was a lot of people who really should have reflected on their behaviour after that meeting because it was very unedifying. Go ahead.
Well, you just used the word that I wanted to use. It was extremely unedifying, and I suppose we all need to learn lessons from it. And I suppose, Chair, you too, probably in reflection, may not have gone to that meeting when you realise, the level of scrutiny that the public made on going to see the witness prior to the meeting. I just think it is unedifying, but I don't think we need to turn the guns. There was a lot of unedifying behaviour by a lot of people in this room. I was very, very embarrassed with it. I think people should have been able to ask their questions. The Minister was entitled not to respond to them, but there was nothing in the legal advice that said there was no legal impediment for the Minister to attend here. She could not comply or not answer the questions, but the members could ask the questions and she could say, I'm not replying to that. And there was a lot of people saying that's party political. Well, really, we are politicians. Right. And we are parties. We're not one group of people. We have all questions that we want to answer. And I think really that the question here needs to be more about restoring the confidence back into this committee and into politics, because last week or the week before did a lot of damage, and I was not happy with it in any form or fashion.
I don't think anybody was. Claire, go ahead online.
Thank you, Chair. I suppose the particular circumstances that led to the meeting without notice, if you like, to the committee was very particular. It's probably unlikely to happen again. However, I suppose I do have sympathy with what Timothy is saying in relation to the nature of it. And, you know, I appreciate that it was the First Minister who had requested the meeting with you, but maybe at that point, you know, even if it meant messaging us or calling us, maybe rather than accepting that without the support of the committee, maybe we need to reflect on that a little bit.
Okay.
And maybe, you know, just given the nature of it, because, you know, really what was the purpose? And that's not for you to answer, Chair. That's for the First Minister, I suppose, to answer. But, you know, why did she need to meet with you? And, you know, that's what I would have been asking if you know, if we were given the, you know, the decision on whether you should have done that or not.
Well, yeah.
But I do appreciate it's a very particular set of circumstances. I appreciate that it's you know, everybody was under pressure with it, but I think learning from it, moving forward, in circumstances like that again, if maybe we do seek the approval of the committee within a certain time frame before we move forward in doing that. But I don't think that will be the case for every meeting that you have with ministers, or I just think, just given the nature of that particular one, I would be sympathetic to what Timothy's saying in relation to that.
Okay, Carol, before I bring you in, actually the clerks remind me I need to put the Timothy's suggestion to the vote then, or
However, if Ms. Curran wants to speak to that.
Oh, sorry, do you want to
first.
speak to that, Carol?
Has he got a seconder?
Give me the proposal again.
Go ahead.
Sorry, a seconder isn't required for a committee to make a decision.
Okay, the proposal is that before the chair would meet a witness of a political nature who's coming to this committee, that she seeks prior, or they seek prior agreement from the committee.
Mm-hmm.
That's fine. I have no problem with that.
Agreed.
Agreed. Okay, Carol, do you want to come in?
I don't agree, but anyway, I don't want to divide. So there's a couple of points there. I was going to raise the issue, so just want to raise this first. I appreciate the cut and thrust of politics, but some of the things Timothy is saying about definition of women, I find homophobic. And if it was sectarian or if it was racist, it would be challenged. So I just want to put that in the record. He's entitled to his view, but we're entitled to have a different view. And I honestly don't want that to be seen that that's the position of the committee, because if, you know, that's going to continue, we need to go around and ask everybody, do they agree with them or not? I mean, that's how strongly I feel about this. The other thing about asking questions that's not related to the department, well then it's just going to be a free-for-all. So we all have to take responsibility. Yes, we are from political parties and we do have different political positions. But let's be honest about this. None of those questions were in relation to TO. And people will agree or disagree. So if it's okay, then, you know, you can park it and we can come back to this some other time. But the idea of people, you know, pontificating about political differences and asking party political questions, particularly on such sensitive issues as safeguarding, I just think was a bit raw, to be frank. And I also think that in the middle of all this, the victims of Michael McMonigal and everybody else were lost, completely lost in the middle of all this. So I just want to put that in the record.
And can I put something in the record as well, Carl? You made a comment during when someone raised about safeguarding, you go, throw safeguarding in there. The victims at all stages was front and foremost in my mind, and I would not say that others didn't hold the victims at the centre. So you can't make judgments like that either.
Okay.
No, for the record, it wasn't about you at all. So I'm disappointed in your reaction because I thought you understood where I was coming from. To be frank.
Hey guys, I don't.
About comments again.
Excuse me. Okay. Brian's been waiting to get in. Claire, I'll bring you in next. Go ahead. Go ahead.
Yeah. Look, we're not going to agree on the conduct of the First Minister across all parties at the last meeting. And so be it. I stand by the view that it was relevant to ask questions about the safeguarding practice in this building by the First Minister's party, because there are huge parallels with what we're dealing with under historical institutional abuse. People being moved around people in positions of leadership pretending not to know what was happening, all the blame being put on junior people who are then dismissed, and a story that quite frankly doesn't stand up to scrutiny. We have a responsibility to ask questions, to probe the account that we're being given. We might have reached a point where no more is going to be said, but let it be seen who was evasive. But we have to do our duty as a committee on behalf of the Assembly, on behalf of the public, and be seen to at least have tried. So I do think, Chair, you were put in the position where the First Minister was expecting you to police the questions, and I do think that was unfair on you. I understand about the legal advice, but the whole thing was very unedifying for this committee and the Assembly. It's not how we want to conduct our business. Nope. We're in a competitive process in politics, but you also have to cooperate with each other. We have to work together for the public good as well. So we can turn every meeting into a dogfight, but is that in the interest of the people of Northern Ireland? We have to also find ways. So the competitive side is one part of it, but cooperating for the public good and at least respecting each other's mandate is also part of it. So, so we don't expect to agree on everything, but we do have to be prepared to at least work in the same space and at times cooperate for the public good.
Okay, sorry. Claire, you can have the last word on this. Go ahead.
Thank you. I suppose I was going to ask Carl, in her role as Principal Deputy Speaker, how the Speaker's Office is advised whenever we're getting off topic in terms of a debate, and how the Speaker brings people back into that debate in line, because I suppose really we should be mirroring the example that's set in the Chamber as a committee. So it's just, how can we better ensure that we're chairing the meeting effectively, but also giving people the space to say what they want. Certainly if people are going to ask questions, as the Speaker would say, Minister, it's not within your remit, but it's up to you whether you want to speak. That's what I understand they would do, but maybe that's something that we take from the higher level of the Assembly. And a second point, maybe this is for a forward work programme section, but and the First Minister did say that safeguarding wasn't necessarily the remit of the committee. I understand that it was, certainly from the board's perspective. It might be something we want to look into, just because I do think safeguarding generally is something that we all need to be really conscious about, and this whole scandal, if you like, has given rise to that, and I think we could all do better in that space. So thank you.
Was that agreed by the committee?
Is that agreed then? Yeah. So if you could do a little bit of work on that. Okay.
Just one thing, it'll be brief, to correct the record, as you pointed out.
No,
I
I'm
didn't
not going
just
to.
not attend the meeting in Londonderry. I had other prior engagements in the constituency.
Okay, thank you. Okay, members, so that's the end of the meeting. So our next meeting's next Wednesday, same time, same room. Thank you.
Committee Room 30, sound. Committee Room 30, sound.